asalaamaaleykum askan bi maa ngi leen a nuyu yéen mi ñëw seetaan man la seen docteur Pa Amadou Soxna docteur bi pour Male Vitality Project bi Male Vitality Project bi soo ko déggee mooy the project that we've started pour dimbale askan bi waaye nag liñ focus mooy góor ñi.
The reason why we felt it was necessary to start this project is simple. Gambian men were not living long enough. Statistically, just black men in general around the world, we don't live longer. We're dying earlier than our female counterparts. But also the quality of our life is not as rich.
Parce que gis nañ ne góor ñi moom ñooy borom kër yi ñooy génnekat yi dépassé waaye amul benn projet boo xam ne bu leen a seetaan la bu leen a dimbale leen pour seen wér gu yaram projet bi ñaari arms la am na part boo xam ne every Sunday nga ñëw ci clinique bi ñu defal la sa blood test yi checkal la sa vitals yi an waxtaan ak yow pour xam jànkuwante yi nga jànkuwanteel pour sa wér gu yaram ñu advice la dimbale la ci.
Today we are here for me to check your body composition, your blood pressure and blood sugar. From there I will take your information. If you have any question that you can give back, feel free. Here is safe and we are all the men that are in the clinic today.
We never charge Gambian people to check your blood pressure, to check your blood sugar, to check your body composition. So the only thing I am paying for today would be my testosterone test to get my levels and then be in a position to at least be equipped with information.
Generally, testing to check for the metabolic problems like diabetes, to check for high blood pressure, and to check to make sure that their PSA are fine, for prostate be, and also to check for testosterone level. How many no testosterone be watching. So more that you definitely regularly post-screen.
Because as we've talked about in our programs, most men's prostate increases with age, but also is a marker to make sure you're preventing or you're screening for prostate cancer, which can be serious, but it's easier to manage if you detect it early.
And generally, loolu la so ñu ngay ñaax képp koo xam ne ni góor la, especially people that are above their 40s, to get their test done.
Assalamu alaikum askan bi Ismaila dellusiwaat Kampe Jambar season 2 episode bu ñëw dugga si ni episode bu am solo. Season 2, actually, this episode is sponsored by Innovarex Global Health. Foo xam ne ñun moom lañ foofu lañ dee liggéey mu nekk bunti wérgu yaram te lu tax ñuy sponsor episode bi is very di ngeen ko xam suñ xuusee daal dugga si episode bi tuuti. Because episode bu am solo la because last week ñu ngi defoon episode on STI te promise on nañ askan bi nañ isolate HIV AIDS ñu am special episode boo xam ne nañ waxtaan askan bi si mbiri HIV AIDS boo xam ne ñun bu njëkk bi lan la li si daan wax sida ba bala ñoo xuus duga di wax nit yi jërëjëf episode yi response bi has been good nit yaa ngi wax ne suñ episode yi hygiene bi nag nit yi lu ñu dee wax yëpp lañ wax but I think it's very important because tey rek dafa tax nit yi gën a bàyyi xel so next time ku dugga place boo xam ne nit yaa ngi around da ngaa gën a bàyyi xel su ko defee doo am any baakaar si nit yi but anyways ma bàyyi booy ñu nuyu wante njëkka am na ku nduru seet nag tey xaw ma dafa ñëw pour wax ñu ne am na lu dugga wala luy pare dugga si waaye moom laay bàyyi mu njëkkaa nuyu booy yaa ngi nduru seet tey
suma néebo bi
أعوذ بكلمات الله التامات من شر ما خلق أعوذ بالله من الشيطان الرجيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي donc maa ngi laa fay
léegi taalibe docteur Pam nga de
non léegi kilifa laa so dara dugagut
waaye yaa ngi nduru seet
dolli leen ñaan rek
waaye mu ngi ñëw
dolli leen ñaan cat jiguma
waaye mos ngaa dégg dress for the job you want.
Exactly.
Not the job you have.
foofu laa toll.
te yow noo solo nii you're dressing to be a groom.
Thank you foofu laa toll nii soo tey moo gën ma lii takk bootaay di nuyu askan bi di nuyu
nag ma jiital sama boy bi.
billaahi wallaahi talaay.
yóbbu ko si ndaw si.
billaahi
ndax bis bu neexee ne
man
di ko conseil nag naan ko bu mu la njëkk a tëdd si
moo
la
war a dem joxe sama bopp.
waaw ma laaj la dara.
waaw
naka la ñoo prouver ne yow virgin nga.
bés boobu.
xam nga society ma ne xam nga suñ society.
waaw
bu njëkk bi am na si ñu daan prouver ne jigéen virgin la.
waaw
lu tax bu góor bi amut.
bu góor bi dee dog lenn la.
mooy lan.
yéen a may gunge not so.
déedéet waaye ma ne nag.
waaw yéen a may gunge ah.
waaw
yéen a may gunge.
waaw
mais suñu nekkee ne dañoo toog si bunta bi.
waaw
yéen tamit still mun ngeen toog si bunta bi. xam naa ne Moussa jox na ma 8 tips moom mi maa jox 8 tips.
waaye loolu mënut a vérifier ne. yow xamuloo jigéen.
non waaye xam nga dog comme jamono buñ toll nii muy virgin bu jigéen virgin bu góor yëpp kooku mënoo ko wax nu ñoo sëyee si jamono boobu lañ toll right now.
waaw waaye ñun li ñuy wax mooy góor. how do you test his virginity as a man.
amut
how long lum laas rek. déedéet dog mun naa ko how long lum laas. because of ku yàgg a store dog nga toog yaa ngi ko yàgg a store téye ko for so many years right now.
am na góor yoo xam ne mosuñu xam jigéen.
waaw.
first day bu jàkkaarloo jigéen mbir mi du dox.
waaw loolu anxiety daf ko waral.
so déedéet nu mbiri anxiety dama ne. society we have double standards. We have all these ways of trying it as a purity test for a woman.
Right.
What's the purity test for a man?
boobu de moom xanaa man ma commencé ko bés mu ma ñëwee waaye di dellu di wax dog boobu am
dañ ko Omar test.
Omar testing waaw mun nañ ko starté si man I don't mind pour ma nekk di first person to carry out that experiment I don't mind waaw waaye di leen nuyu rek di nuyu askan bi di nuyu suñu gan bi tey ku ñu fi dalal ñu ngi la suma Keba welcome to the show di leen wax ne tey moom topic bu important lañ leen indil ndax ñun moom lu gaay ragal a waxtaanee ñun camp bi fii ñun lépp lañu waxtaanee lépp loo xamee ne daal si wérgu yarami jàmbur la nit yi dañ ko waxtaanee te topic nag tey bu ñu war a waxtaanee gis nañ ne Gambien ñu bëri ñu ngi ko dunda bot ñu ngi nëbbatu so tey dañ bëgg a ñëw rek ñaax askan bi waxtaan ak gaay naka la ñoo mën a aaree seen bopp ak ñu ko am tamit naka la ñoo gën a mën a fagoroo donc delloo naa la kàddu bi ba si kanam.
jërëjëf dem si wave bi noos booy wave bi fu mu toll war ngaa baabu de.
waaw dëgg salaamaaleykum mbaadiŋol
ñu ne borom wii su strane nga koy xam.
feeñ na de xam naa.
waaw dafa mel ni Keba si sa fraternity of wave bi la bokk de
Keba suma groupe bi la bokk.
Keba mu ngi si wave fraternity bi de baana.
mbaal kontaan na ka faale kampe jambar mo lom mel kanale jang wato wati pour ka hakkilo bulandi alla jata kende ala karola ngalon ne bi nga episode dole sotale karuna episode kake kacha kulti me alon ko ay kumayata bakele molla jata kende ala karola bi dung nga kumole sotale alon ko wala nga topiko bi nyanta men kachala kumayata bakele katu ngalonen tol wato wati comme ka fa nyame ka topic na terron akake kulti me alon ko mol ba balu kanne sako diamol wala kacal me alon ko mbuka moy bake jamal buka fo wala jamal buka hani ka fo ndol jamba fo la janne katu pare tan na mol le karandila kanyo hakili bulandi katu ngalone ngawoda male soto jang tumando mieta ka fo janne du modo bi jani man ko do diala bari ni hakil bulandi ala jata kende ala karola tumando ala kende asina kusiyama wala ala jata kende ya samba do ko ke fay na ko do soto me alon ko ite ma soto no ka diala so ndole natale wevi na la mol Dr. Baji na la mol bi nga lonta nga soto jang Keba me alon ka bala ko mol ka fulankang pour ka mol hakil bulandi ala jata kende ala karola so mba fulale alesi ali ala moy.
Merci beaucoup Imam Kampe.
Yes asalaamaaleykum wa rahmatullah askan wi ñu ngi leen di nuyu di leen ziyaare di wax ne jërëjëf last épisode bi gis nañ comments yi te man bi ma gën a yéem sax mooy mag yi suñ anti yeeg suñ oncle yi di wéy di appreciate it jërë ngeen jëf comme ni ko booy waxee rek back again soo leen gisee nag Sol Medina tey weer bi teeru na weer yonente bi teeru na ñu ngi ziyaare ñëpp ñi nga xam ne ñu ngi koy maagal di leen wax bon gaamo ñun taalibe yi weer bi su jotaan wala su jotee daf ñuy yokk fierté daf ñuy yokk kontaante suñ sëriñ su weer bi taxawaan daf daan wax ne Hani and Ibrahima mooy ne man Ibrahim maa ngi ndokkeel sama bopp parce que ci weer bi kon képp koo xam ne ni mu ngi célébrer ñu ngi lay ndokkeel ci weer bi di ñaan yàlla leer yonente bi sallallahu alayhi wa sallam doore appear continue to appear in our lives kon we keep the ball rolling.
jërëjëf tey moom mbégte tamit ñu ngi am gan suñ brother bu baax bi Keba agsi na si campé bi tey te dama ko wax ne mu indiwaale loo xam ne suñ si xuusee tey moom di ngeen xam waxtaan bi nu mu amee solo waaye koo xam ne liggéey ay paquet de te am na booy am na ñum jël seen fit nag waaye nañ dugga si boobu waaye koo xam ne yaaga naa gis liggéeyam si biir dëkk bi fii ñu bari dama dee wax ne ñu dee def liggéey boo xam ne ñu bari ñeme ñuñ ko léegi nit duñ ko dee xam so bala ñoo bàyyi Keba mu nuyoo sax pour mun laa wax rek jërëjëf si service to nation because liggéey boo dee def liggéey jaamu yàlla la liggéey boo xam ne ñu bari ñeme ñuñ ko la si biir dëkk bi waaw ma baala nga nuyoo bala ñoo dugga si biir waxtaan bi.
Assalamualaikum. Thank you so much, doctor. So mel ni nga ko waxee rek topic bu mu war a ñoo discuss tey it's very very important dafa nekk topic bi nga xamante ni foo munti tur bi rek ñëpp a leen ragal. Yes kenn bëggul koo wax. That there is a fear in it. Koo munti dégg mu ne HIV rek. lu ko gars yi ñu kaa foog moo nekk xanaa fa taxawaalu woon. But then dafa am lot of things li nga xamante ni moo ko surround. Yeah. So ku nekk mun na ko am. So there's this slogan that is always said, you are either infected or affected. Because say for example, like su nekkee I am HIV positive, mun naa dem si ki nga xamante ni sa rakk la wala sa jarbaat la wala sa doom la aussi. So moo tax ñu ne you are either infected or affected. But then nekkul feebar bi nga xam ne da nga ko war a ragal waaye nañ dem ba si kanam rek dina si am waxtaan bu leer.
jërëjëf te foo laalee sax moo baax because man dama dee wax ne the first time what was the first time you knew about HIV?
Since bu ma nekkee xale dama ko doon dégg.
How did you find out?
Like it was like soo ko amoon yow si society boo nekk foofu moom yow dañ la point fingers. Suñ déggoon ne diw sangam am na HIV suñ mbokk yi ñu ko sida te ñu ngi doon seetaan different movies tamit dañ ko doon add dafa amoon a big stigma bu attached to it.
xamuloo kenn seen sa family.
No.
ku mu sa dee.
No.
yow nag. yow.
Ntenga mera na wati folol atekela lungoti mealo ngalo bari watol mealo nganyeng kalamuta katung ndela balu nga jama ke sojar kampolto.
Okay.
Andu ngalo ne action 8 nunto a jama bije la nyim programme wala ni sojarol ka trininol sotole wato wati. So ndalla wadindi ya wato ngajele ka fo ñil lenata ka ñil train HIV la do akake ko watol di mealo ko mbukalon no munam no bari ka to moy bakele AIDS silobe warari no ko mo moy AIDS ak joya fara bari na wodindi ya wato ni kana wato wati ka ñil train ngaje la tisa tol bale kamel di la gaf action aid HIV katara bala so o watol do rang nga karanne nga moy bari wayatram amam ko na bake mem dal.
So can see a Muslim family member could there?
No, man amut.
Not there, but I have known like two that died of HIV related.
Yeah.
Yes.
So Mansuma auntie, I'll tell you guys a story. It was maybe early 90s. Someone you get a kind of thing, body back out. So I have done them MRC. That have done you a garab you body at that time. Ken Hamusi Wandara. Then after Simuganyu. So as a kid, Nyep Ken Hamutone, she was HIV positive. She was receiving treatment at MRC at the time, Lol Moko Yobu. So Malaw here, Legi, I don't remember any conversation in family around HIV. But Sumaya at some point, Momo Hane, Ndam Siyala Li Moko Yobu. But I guess nessa around the world, Hidna Nyohamne, business story, Magic Johnson. I think new buddy, I guess newspaper be November 8th, 1991. Magic Johnson's career ended by HIV positive tests. Mu ngi laa wax àdduna bi fu mu nekkoon at that time. Because nit yu bari dañ foogoon ne mu ngi deesi. Right?
I mean, even with me, when the first encounter with HIV AIDS for me was in primary 5, I think.
Okay.
I had to represent the school for drama competition, National AIDS Day. You know, when they used to, when they used to do that in the primary school. And and I was the main actor in that drama. And the storyline is promiscuity, ending up man xale bu góor la, partying. I can still remember the story. And you come back testing positive, waste one day positive. So that's how it used to be, the story at that time.
So loolu laa la wax earlier on, like society buñ fekk like buñ find ourselves dañ jàpp ni ku am HIV rek either you engage into sexual intercourse.
Yeah.
It's beyond that. It's beyond that because take for example su nekkee like I am sick, ma dem si lopitaan and then someone is donating me blood. If this person donating me blood, testing blood and that blood is donated to me, I am at risk of being HIV positive. Because like I said, if someone is taking medications of HIV, by a particular point, they are undetectable. Undetectable means that there is less likely for you to transmit the virus to a HIV negative person. So I guess most people, if they are positive, if they're also undetectable, then they call, hey Keva, I am O positive, I guess now kubuga donate blood, can I donate? So as someone that is HIV positive, you cannot donate blood.
You cannot donate blood.
Yeah, but then you body like so say the society bu nekk dafa kii dafa am HIV sex moo tax ñu bëri dañ leen nubatu. Da nga gis ñeneen sa jëkkër ak jabar kenn ki am HIV daf koy ragal a wax partner. Because dafa wax ni xanaa da nga génnoon wala nga nekk di ci
that I'm dealing with. That this woman came, I'm losing weight, blah blah blah. I tested it's positive. So the dilemma now is ne dama tas sëy bi because mu dee jëkkër ji xam ko. And I'm still debating with her how do we play these actions but like you said again the notion is that dafa demoon friend to positive.
Like the ideology of HIV should be changed now.
Why focus on the branding because tani hale I'm going in Chiduga because HIV is one thing and AIDS is one thing, right? It's like a condition and destination. Why you never many theaterio sida it was a death sentence. So part of it too, I think, we communicate.
But again, it's like Africa. I mean, we know that you go to the hospital at the end of the day, at the end of the road. Because them going to see syringe, them going to living, them going to that's the truth. And then when you come to the end stage of it, when you are at AIDS, is when you come to the hospital.
Exactly.
And then that's what we see. But the good thing is that like the thing I'm dealing with, somebody has just noticed that I'm not normal, and then you come and you test and it's positive.
But most of the times, when it comes to opportunistic infections, AIDS do like that, pneumonia, tuberculosis. So infrastructure, so for negative, pull guy muna testa, yo danga ganyo right, and then everybody else there's an exposure trail. But what be them na not Gambia we had a dark side when it comes to HIV because at some point a former president dafa ñëw yaxakat ak yëpp.
But like the former president. It's not about saying, see, 21st century, people still believe in like herbal medicines. Then I just need like
not even herbal medicines. Some people don't even believe HIV is building.
So sometimes I know test need to consult and clear like you tell the person that I am positive. The flele okay, my MC syringe. And then like yo, young them syringe, mulai jo garab, but yo fajulo. Like you are doing more harm to yourself than good. Because it affects the liver and every other thing. But young guys still make them for like clearly anyone that is tested to be HIV positive, during the counseling, you are clearly told that you cannot mix this with herbal medications. But society wouldn't correct more everyone believes me su nekkee dara daf ma jot daa ma ñu kaa dem daw si sëriñ bi mu jox ma ñaan wala mu jox ma garab and so lii moo nekk mindset suñu war a change because I can fully remember HIV. I knew about it in
so how long you've been working?
So I've been working into HIV advocacy for 7 years now.
Wow.
When I was at the age of 17. Because I know of people that are... Sorry?
What got you into it?
I have people close to me that are HIV positive. Yes. I have a friend of mine that is positive for 6 years now.
Wow.
Because he started taking medication in December 2019. So this December, I'm going to 6 years of taking medication. And this guy is like, you documents like his one does this person is positive. You cannot. He's taking his medication, he's undetectable, and he's living a healthy life. So, don't let what ham now. So you are positive for HIV. If you are taking your medications correctly, you are less likely to transmit the virus to someone else. You are less likely to transmit the virus to someone else. So so coming down, how can one get HIV?
But HIV from the Tole in Gambia. What's the percent?
Percentage right now?
Yeah.
Actually, no idea.
Yeah.
I am not exactly sure. Coming more jelle asoto, but
Do people even admit that it's still around? Because I'm going to it's like it's disappeared from national discourse. Because they want this is the money. Mange HIV and things like that.
Yeah.
Right? Because a lot of people don't know.
No, dama jàpp ne they don't know, but dafa nekk nag comme saa duñ ko dee waxtaanee.
Exactly.
Comme dafa nekk mandar nga boo xam ne dañ ko ragal a tudda di ko waxtaanee si société bi foog naa looloo tax mi ngi xalaat fade away a little bit but nit yi ñu ngi ko am.
How much if you guys seen just last year bu National AIDS Secretariat gaining some data on HIV. I think that was more than 26,000 people living with HIV.
Yeah.
In the
And,
Gambia.
yes, and there was a lot of debate of people be like, oh, there are this number of people living with HIV in this country.
Right.
Because these are things that are not being aged. Because the last time I can remember, cool condoms.
Yeah.
I was either 8 or 9.
Bicycle.
Yes, cool condoms. Like there were billboards of cool condoms everywhere. But then I haven't seen like any billboards or any advocacy on HIV nowadays.
None.
There are none.
Yeah.
So niti hamun. Because I said most people of teenage, most of us are sexually active, like young adults. And most of us, we do not have this conversation about sex.
Right.
Like not with our parents, not with teachers. Because I can fully remember in grade 5, there was this topic of HIV. Grade 5 or grade 4? HIV and STIs. Like the teachers will not even go deep in it.
No, they didn't call out.
They will not go deep in it. So there are certain things they have like topics as of such. Dang si wara waxtane bu baax. Pour xalé yi gëna si mëna understand and then because so waxé nit dara dina si gëna bay xel.
Yep.
Yes.
Yep. No, it's true. Yang gets data be about 26. Anywhere you see in terms of prevalence, then they were less than 2%. Legally 1.5, 1.8, but somewhere around 2% in the adult population. While a lot of time it's tricky because name do a little bit. So about 26,000. Teluma bu wana la rek in terms of how they measure dekabuneka fan la tolu simbiri HIV and AIDS, right? Tenam move in people suñ view si mun ko gis. Yang I guess ne UN AIDS then they want a 95. So dekabuneka then they just report card, right? They want 95% of PL-HIV people living with HIV to know their status. The hamga bobu, the only way for dore,
It's just tested.
self-test kit, right? But my grade report card number 1. Then 95, Gambia sin report bi 1% lañ neka. 64. Bo ban grade la D. Right? Then ga wacha, hamga knowing your status, more than they want a prevention. Fofula de dore, awareness, right? Pull measure prevalence. 95%, Gambia is at 64%. And then the next level, nit ñu am Hamsen status. How many people are on ART, antiretroviral medication, for HIV? Li nga xam ne te di nga ko gis, am na bu njëkk bi 30 different tablets ngay jël. C'est man bi. Léegi lii, quantity ñaata? 30. 1 tablet a day, right?
And free.
Gambia, ñu ne àdduna bi 95, ñu ngi ñaata? 70%. Boobu ban grade la? C. And then nga dugga bu gën a xam nga it's the step dafa mel ni suñ funnel bi. Awareness, treatment, and then treatment success. So viral suppression among people that are taking the medication, they want 95%. Gambia is at 79%. Tali is based on the National AIDS Secretariat 2024 report, right? So coverage bi yange gis ba mung la wane systematically because suñ deka bi tamit ñu ngi hawa ñu ko bàyyi gannaaw a little bit. We're not talking about it enough. We're struggling. Te man lu ma dee xoolee façon yi dama dee wax ne lii yëpp is exposure to every Gambian.
Yeah.
Going back to infected and affected. Comme no one which is perfect. Lii dafa mel ni yaa ngi gis fii yep, everybody's affected. So almost 36% of the general population, right? Te fii yaa ngi gis gap bi 30% that are on treatment that know their status. And I guess ne léegi ñu ngi am 30% exposure to the general public. Tam nga léegi nañ ci dugga nit dañ defoog ne lii duma musa laal. But mu ngi laa wan ne rek we have a way to go in terms of Gambia bi fu mu nekk nii te ku nekk foog mu laal si sa loxo. And then nga duga. I'm going to know about 2%. So in HIV care, to lean into watan, then they identify the key population. I'm going to lean numbers to change from nekali. So they get a key population in terms of HIV care. Who have the risk before for like an body. I'm got population so 2% that I negofa. You know a little bit deeper. I guess the 4 categories of key population. So what key population include prisoners, but PUWD, people who use drugs. Female sex workers. Men who have sex with men. So yang guess now what was 2%. So CB I guess 3 out of 10 positive rate. So I'm going to change that dynamic what time. But I guess trends, right? What are the trends? We're moving. Female sex workers increase. MSM is going down a little bit. Why munglag just ne ligay bi wara def dafa bari. To maybe hinna buga na nga lasi lolo because Gambia the biggest problem in healthcare system was denial. But also people don't trust the health system to seek care. So buga na nga lasi.
This is one of the problems.
Yeah.
Like there's a huge gap associated with medications. Like ñu nekk di liggéey ci HIV care, they are doing a lot. Yeah, but then society sometimes or most times the facilities are not convenient for PLHIVs to work in.
Yeah.
Because there's no enough space and then they are trying to do that to limit the stigma surrounding it. But today I am positive for HIV and then I walk into maybe Bundung Maternal Clinic because in each region you can have there are a lot of art sites and you can walk there and get medications for free. So them now to Bundung art site and then it's a test clinic. People taking TB medications are coming there and then people living with HIV are coming there. And then I just do salvi and then I am just meeting people with TB. Guy jale le ma dem ba ci biir. Ñu nekk salvi they might have question. Ñu du mu jall ci gannaaw.
Yeah.
Wala nga dem ba ci biir fekk fa ñaar wala ñetti nit. So wala nga dem tamit ci l'hôpital bi fekk fa nit bi nga xamanteni xam nga ko. Ci society bi. Man I feel like how people feel comfortable to talk about high blood diabetes, that's the same thing or the same way that people should feel comfortable talking about HIV. But then te mun am sa hospital sama gis nit kuma xam instead ma dem jël suma results yi damay dem da nga gis sometimes there was a time I engaged some people working with the HIV PLHIVs gañu da nga gis nit ñëw test gañu nako xara nga jël sa result because you're going to go to the lab after kooku mu dem do ko gisaat because mun am gis na kum xam fofu nonu wala mun am there's something li nga xam ne moko dowlo so li yeb dañ wara bayat xel pour seet naka lañ di mun am access to service ba pare Gambia dafa nekk dëkk bi nga xamanteni it's not compulsory for you to take medications.
Yeah.
So I feel like in order for us to reach this 95, anyone that is tested for positive, you should take medications.
Yeah.
This is difficult because munga ma jox garab to be taking HIV medication, ma dem kër duma ko naan.
Yep.
Understand?
Yep.
Ma dem kër duma ko naan, ba pare they infect other people. Even though there is a act on that, if you infect someone willfully, like there's a law on it. But then how will I know who infects
and how would you enforce it? Yeah.
So these are the challenges that you want to am. I guess nobody don't remember say don't test before they get married. Well, you guys are having sex, doing all form of foreplay and every other thing because it's an advanced world.
Yep.
People are engaged into anal sex, people are engaged into oral sex.
Yep.
And all of these puts all of us at risk. Because we're sharing the same girlfriend. Who knows? Or this man has different girlfriends. Well, sometimes you want to have sex and then you can't have it with your lady. I'm going to say sex workers.
Yep.
So these sex workers are higher risk. So li yep li nga xamantene yoon la nga xamne ndax le mëna am HIV ba gëna ci mëna ar like basic help gëna mëna ar bopam. So nit so nekké dem nga ba xamantene you HIV positive. Li la lay wax sama clients yu bari. You can Gambia bari na l'hôpital yu mëna jëlé garab. Su nekké yow dem nga kaani fi nga ne you know someone there, you don't feel comfortable. Dema bundum. So only has dema base di jël garab every time if you want to. But just make sure that you are taking your medications. Bi nga xamanteni yow di nga live a healthy life. Because if you are taking your medications correctly, di nga mëna am doom te do ko mëna wala sa doom te di nga mëna am jëkkër wala jabar te do ko mëna wala. Or even your partners. But that means to your partners has to get tested and they are negative. And you that is HIV positive should be taking your medications correctly.
Yep.
And then making sure that you are doing your viral load and the CD4 count test and everything. Yes.
It's one of the only conditions in the Gambia where healthcare is free.
Yep. Yes. I went to South Africa and then I got engaged with some of them that are doing this work, and then they said they have 2 million people living with HIV.
Yeah, 2 million,
And
more
I'm
than the
like,
population of Gambia.
Is just 26,000.
Yeah.
And then,
Nga
because-
story mo ile about South Africa malo for Tonyalo.
The highest
Yeah.
prevalence rate.
Because iko bira kumasita iko there is more le bije men ko gale ko ni lafta ay boyla pour ay yekende ya inen vaginole be lala. So iko jamal bite ikata ka sunku dingol rape
And rape cases, yeah.
iko wala sabo asiata wo nyama sako satel mambo ko South Africa in Kenya.
You know, so set Logan Buba, like during Jambes era, when he said that he was gonna he can treat HIV. Sila si ñu jare like Daisy.
Yeah.
ñeneen ñi nga xamante ne lokki neen si they are still going back to take medication.
Medication,
But bu mu defee that announcement si la MRC stop it and then most patients were discharged to different hospitals.
Yeah, but even doctors, I don't think you
Yes.
guys were allowed to diagnose somebody.
So these were challenges that people face.
But no, for doing water.
So man tam ma seetee like because there was a time to engage some personnel that are working with HIV. Gaa ñu ne before if you are tested for HIV positive because medications like there were not enough medications.
Yeah.
So lay xaar ba sa viral
Egg to something.
then gaa joga la jox garab.
Yeah.
So I believe that those people I'm not blaming but then yes they are one of the reasons why HIV egg fi stage B.
Okay.
Because su nekkee yow nit ñëw na mu test and they're HIV positive xam naa the country like are heavily relying on fundings but then there should be strategized ways yi nga xam ne moom nga waroon a use nga xamante di nga mën a jàppale ñi nga xam ne they're HIV positive than waiting for them to go back to their families.
Listen, déedéet lu kee maa wax askan bi dañ bugg a dégga lu mu wax. Amoon na jamono Gambia ku am HIV positive duñ la jox garab dañ laa bàyyi ba nga gën a feebar ñu dog laa jox garab soo gisee problème buñ am fu mu nekk nii parce que xam nga nit yëpp xalaatal loolu yow positive 95 know your status start treatment be virally suppressed Gambia dem on that period ñaata years boo xam ne loolu nekkutoon di dem in place
2026 Gambia is still depending on funds for this.
Yeah, because I had like friends from South Africa now like they're having a challenge to get medications.
te ñun
Because they were relying on funding from America. And then now, who do not run your stop loss funds?
stop funding.
And not even South Africa, a lot of other African countries
Yeah.
are suffering. Because as even said in the Western world, most of them are buying medications. And
Yes.
they are very, very expensive.
Yes.
Because I know a lot of people, who holidays in Gambia, they will contact me, hey, Keba, I need PrEP.
Yep.
So that they can use it. Because some country is very expensive. Their insurance have to cover it or else they cannot afford it.
But su ma la waxee how expensive HIV meds xam nga bala ma doon ñëpp si Gambia community pharmacy bu ma doon liggéey ñun ñoo amoon contract in North Carolina bi. We used to do about 1,000 prescriptions a day. You see ëpp yëpp HIV medications la daan nekk, right? Every single month, $4 million of revenue lañ daan make. A month. $4 million. Because lii benn rek léegi wàññeeku na sax am na generic. Lii bu mu nekkoon brand name. Te xam nga léegi dañ dee wax ne okay, even resources are not available. One condition boo xam ne access to medication is free. The entire mun ngaa live in Gambia. You actually have a better chance of living a long life in Gambia as an HIV positive person because you have access to medication. Why ba léegi ñu ngi struggle pour nit yi test njëkka sax because it's denial. But also, why do we think in the MSM community is 31%? It's also the elephant in the room, right? 3 out of 10. Lolo is a symptom of something. Also understanding a former president, what the country was, but also MSM also, and I think we should touch on this. Am na góor yu am jabar yoo xam ne they're still engaged in sexual activity with men. Xam nga loolu dëkk bi doo ko wax.
Yes.
But this 30%, why?
We find ourselves in a situation or in a society that you know that MSM is something that is illegal in this country, religiously and socially. So people have this belief thing. There are certain ways, anywhere, they will start pointing fingers at me.
Yeah.
So, as someone that is feminine, I cannot walk into any health facility because you can walk into any facility, but then you self-stigma yourself.
Yeah.
So, bad name, like, how will they see me?
Yeah.
But then, earlier, society won't find ourselves, more like HIV prevalence among these key populations are increasing. Because social female sex workers, men who have sex with men, even maybe female sex workers are okay because they have their brothels. So
Send
everybody
the-
Senegal be good dengan len digis and every other thing. But then how about the other population that is MSM? ñi nga xamantene ñu ngi nobatu.
Yeah.
Because I have seen like recently, I think was on Gamma post at some social media outlets about 2 men that were making out in Yundum and they were arrested. Like these people are making out in a room, but how many other men are having sex with men and they're hiding?
They're in hiding.
So,
And they're affecting the entire society as well too.
because maybe these people too are bisexuals. Because I believe in every society that you find yourselves in, there are different kind of
100%.
You are either gay, you are straight, you are bisexual, you are transgender, and every other thing. So there was a time when I traveled and I met a transgender for the first time, I was surprised because I had a lot of questions to ask this person, and then later on I felt bad because I was like, bad to feel like I am asking too much.
Yeah.
Because I was surprised to see someone ki haven't any good and transform to a lady. I was because most have the jiggen. But like when I made discussion with a jiggen, I'm like, oh. I mean, I'm a good one, so trans sex to a lady. I was surprised because
The lady dokam, but so they made Thailand.
the lady boys.
Thailand, I guess to what?
Man kay bu ma yóbbu Thailand.
No.
Bàyyi ma Gambia rek.
So Thailand, they have a lot of lady boys. And
Lady
then,
boys.
And then people will not know that, like, they will think that you're having sex with ladies when actually you're having
Dan
sex
ko
with men.
chase ba be aga.
Nga don't have
Guess
lady
what?
boys.
No, but we don't go Natalie.
These are things that are going like
Yeah.
online, you see it everywhere. So, muy lolu. But pare, HIV, like, you know about this population. MS female sex workers can go out, get tested.
Yeah.
But then, as an MSM, like a man that have sex with man, ngam like an anal infection. Munam so si koy dem, da ngay rusa open up to this person ni lila am. Wala nga simé ko. Because I was watching the podcast, bi nga la wax ni most people will not so fake jigen like a female doctor or a female nurse, they will feel shy to like get dressed, undressed and see it. But then most men too will do the same.
Yep.
There's no like send male fertility program. Maybe I'll feel much more comfortable because they're all men and then there's less discrimination and every other thing. But when I say another hospital, fi nga xamne jigen ñoo fa nekk. And then narusa simeku wala rusa def lenen ak lenen. Because nga gis ñu bari dañ leen even trus pour dem jënd ji condom.
Yeah.
Because there was a time ma nekk fii nii Banjul pharmacy because I live at Westfield. Ma tase fa benn koto mi ne ma jëndal ma kawas. Me in my mind, what does kawas mean? I clearly know what he meant, but ma ne ko loo mean kawas. For him to even mention the word condom, like it was like the family big word to him. So I was like, okay, da nga need condom, mi ne ma waaw. So I went in and buy the condom. Even so most times when I'm jënd ji condom, ko fa lay fekka dafa lay li ñu ka xoolaat. Yeah, so you really moo tax ñu bari dunde like dañ lay ragal a dem into any pharmacy to request certain things.
It's shame. Yow da ngay jënd condom.
Xale bu ndaw
Yow boobu trick question la de. Parce que nga ne si nga boobu ñaa
Moo dugal de
ñu
daf
nga wax ne virginity test. Boobu soo waxoon waaw.
So
Musa?
da nga wax Keba lu very important fii nii. So man just by looking at these numbers man dama waaru. Because of man tey su fekkoon ne numbers yi da nga ko génne nga bàyyi fa lettre si rek man nga laajte ma dama wax ne MS bi moo gën a low.
Loolu nga foog.
Man soo ma bàyyi woon man loolu laa la wax without seeing the numbers there.
Yeah.
So yow lan nga foog moo waral numbers yi dem si kaw.
But it's legal. Mu ngi laa wax ne they prosecute.
Because I had an engagement with some sex workers, female sex workers. Gaa ñu ne ma ñoom su demee Sénégal, they are registered.
Yeah. At some
They are
countries.
registered, but they have to do regular testing.
Yep.
Because Senegal is monitoring like their HIV prevalence in their country.
Yep.
Which is different from Gambia. Gambia sex workers are working, they are not registered. And then I know there are mobile clinics that go out to get them tested, but the majority of them are not coming out.
Yep.
But then if you see Senegal, why they're able to control their HIV, because any sex worker that comes into the country, you cannot operate without being licensed to work. And then if you are licensed, you are given a card, and this card is like you need to be doing your regular testing and screening.
Yep.
You need to. If you do not, they arresting you. From the girls that I have engagements with. So this, I feel like it's a way that Gambia should.
Why fee now?
Yes.
This is my observation. The girls now here are becoming more open than it used to be in the past.
Yes.
I'm going to
Couple of times now you come, I work at night.
Yes.
Why they shame? Man, look at one boy. They name a shame is a female sex worker, right? ñoo la gën a xam seen soxla. They're not doing it for love. Liggéey la.
They are not because da gisee sorry maa lay dog. soo gisee most Nigerians dañ lay ñëw fii and then they're like ñoom dañ am like an aim. They want you to be just here for 1 or 2 years. Gaa am lu gaa dem continue with their journey. To another place wala gaa ñu ngi sampa seen kër yi. So just with an experience nga xamante ne dama lay dem na testing most of these girls da nga lay gis ni.
I'm telling you.
Yes. So small liggéey bi like I get to involve a lot of people.
Are you married?
People. No, I'm just 23.
But why I mean I am just 23.
Keba's dedicated his adult life to work in HIV.
I'm just saying, government context now, for example, I tell Ajahwa today I'm going in the middle of the night as Senegal to test.
Yes.
How will...
So you're as old as Omar's relationship.
So keep more you nga singa stade
moo tax man kay xoolal ma ko xoolaatee.
I'm just exposed. I'm just exposed. So seetee soo génnee guddi pour test ñoo la gën a am moo nekk Nigerian si wala foreigners yi. Our own Gambian sisters are out there working waaye dañ leen nëbbatu. So these are hard to reach people. Hard to reach people because yow dinañ la wax ni ñi ñu ngi génn nga dem si benn brothel mais ni mën naa dem city pop dañu wax Gambian si waaye bëgguñu a génn pour test and you cannot force anyone to come out for testing.
So xalaatal loolu rek.
You cannot force anyone to come out.
Te gaa ñu ngi am client.
Yes, ñu ngi am client. So this is what I always tell them, like you need to use condoms. If you are not using condoms, go to PrEP. Because they like mun naa ñëw customer buy ñëw si yow is the same customer going to the next person. That customer might have another client too, then go to the next person. So if I'm exposed to HIV today, next week I can go to another person. Different week I can go to another person. And then that's how HIV spreads. If the person that I have sex with is HIV positive. So ñi nga xamante ni ñoo nekk HIV positive ñi nga xam ñoo leen si sex workers are the same people going back to the society. Mun am ngay am ay jabar. Mun am ngay am ay jabar. So that's why it's important to go for couple counseling and testing. But deka bii nii most people do not get tested.
No.
It's more like if you when it's crazy.
te dégg naa ne sax.
Bare nañ uyu kan mooy testé man dama testé.
I have a question.
Yes.
Why is he just focusing on sex workers and not talking about needles or any other thing that a person is infected that has used it? Come look at me. Is infected with HIV. When you're there is a likelihood of
transmission.
No, we come in there. The one
didn't know why risk level be, right? So I guess even the way they fund these programs, they worry about the general population, but also if you have communities where going back 3 out of 10 within that community, right? Or at least 2 out of 10. Funga said, okay, what behaviors around those activities are increasing a greater risk? Yes, you could get HIV and then talk on modes of transmission. But the reality is the people that the prevalence is the highest, nyugi banya genasi. Full testing. But for the female sex workers, we have the non-Gambians and the Gambians. The Gambian female sex workers, they get ban treatment at testing. Te ñooñu once again, lu ñooy liggéey kenn xamu ko. Te am nga last time bi ñu ngi doon wax mbiri boy bëgguñ mbiri condom X, Y, and Z. Acca leen rek.
But that is the truth. So most of us prefer having sex without condoms.
Yes.
But then do it safely.
But it's human behavior. You don't know what?
Yes.
The last time we have testing. They care about it. But do it the safe way.
So the safe ways are your ex partner get tested.
Yes.
So both of you are negative. I would advise you.
They can do sacho.
Yes. No, that is very difficult for you to know. Because they mun na am suma partner, madam seeti ko. After next day, man, you ma jaaraat feneen.
When they use our condom.
Wala next week, ma demaat feneen. This is what I'm saying.
Tell all of they happen
so
though.
So yow di nga foog ne like yow sa partner bi is only like yow rek la am. Fekk sa partner bi am na yeneen ak yeneen partner. Da nga gis jaay sax am na mbaraan.
Waaw.
Utee from yow.
Wala ñoo xam ne am nañ wala ñoo xam ne am nañ jëkkër wala am nañ jabar ba pare ñu ngi liggéey.
Waaw.
Loolu daf dee am poverty daf dee cause lu bari.
Yes. So seetee this HIV MSM HIV prevalence bi. So I have like so yang no I'm focusing on FSW, so I'm coming back to MSMs. So the guy ni most people they have sex. They can be MSM for financial gains.
Yes.
Understand?
Yeah.
So some of them it can be natural, like they might want to have sex with men because that is just like natural that they have. But other people, like they might have sex with other men because they want to gain something from it.
Yes.
When I'm like iPhone 16 gain and I will be like, okay, I'm gonna sleep with a man to get it. Well, a man proposes this. There was this artist recently that came out. I don't know if you guys have heard it with the promoter. Who proposed Harris body to be able to sleep with him.
Yes.
So these are things even if you do not talk about it, it's happening in this country.
No, even Hollywood said then when they in a movie role, see.
So these are things that are happening. The funny society is trying to turn a blind eye to it, but either society turns a blind eye to it or not, these are things happening.
Thank you.
Because man, no matter in closed doors, you do not know.
Yep.
What you do in closed doors, I do not know.
Yep.
So I feel like healthcare system should be much more open to an extent that people can come in, get all of the services that they need without feeling any form of stigma attached to it. A doctor or any other one, I'm not saying it's happening, but maybe too it's happening. Nga test ma na am positive nga start di ma joxoñ baram wala nga gëna nit di joxoñ ko ki dafa positive
wala amuñ digital records tamit nga bind ko nga gis ne Amar nii la wala ñu jël ko sax bëgg la blackmail.
Have you ever gone to public hospitals send ad daisy?
St. Clinic Daisy.
St. Clinic Daisy for HIV medications. They all assemble outside. And then most of them haven't any coverage, then anyone can know that, okay, this is this.
Come like, deal now with them, time more than depth, more intensity kind of thing hospital.
Yeah.
But man, to be honest, the more they want, and someone neck on a victim, man, for man, never them.
Because it's just out in the open.
These are the things.
Yes, because of doc, it's open. Ku ñoo toog xam nañ ne barab bii ni HIV patients ñoo fa nekk and then it's open. So man dama feel like ne loolu noonu tamit is a contributing factor boo xamee ne nit yu bëri ñu ngi fan back duñ dee ñëw seek treatment.
Loolu laa nekk di wax.
So how ma ndax yéen tamit léegi am ngeen any contingency plan or anything loo xamee ne.
Yeah. We have a lot of plans because now we are even going in their houses to provide services.
Last mile delivery.
Yes.
Thank you.
So home delivery, like sometimes we have like the wellness on wheels, the mobile clinics.
Sacha ngeen ñu de.
Yes.
No, how am I liggéey bi si lañ bokk.
Waaye sax nañu daal si lañ bokk waaye sax nañu.
Yes. So da nga gis ni maybe I am HIV positive. I am HIV positive and then you are providing services for me. You can call me, hey, it's my appointment day. Hey, Keba, where are you? I'm like, I live at Westfield, but can we meet at Manjai? Because I might not even want you to come to my house, but I can meet you somewhere else where you know I can have access to my medications. And no one knows.
I think that's better.
Yeah, so now this is what we are doing.
You do the delivery system with the medications.
Yes.
Put it in a packet and
Last mile delivery.
Yeah, man.
This is what we are doing now so that like people can have access to services for free of charge without any stigma, without any discrimination. Because there's a helpline, HIV helpline 1223, that you can call, get tested.
1223 HIV helpline.
So you can call, get tested. Okay, you can be like, hey, Keva, the money is PrEP. But for PrEP, what most people fail to understand is it's not available in the government. It's free of charge.
Keba li PrEP si ñu ko xam.
Nañ ko dugal. Take it. Right? Just wanted to give historical context. Te maa ngi laajte booy yëpp ngi noppi kan mooy def self-test.
No, I think everyone is doing. I'm using.
All right.
But then
we're going to do a live demonstration.
Yeah, can I come?
Yes, Lala Sibobo.
So
It will give you.
I have had a discussion with most of my clients, well, most of the people that I am working with, and they will be like they're using self-test kits. So what people need to understand is if you are HIV positive and you are taking medications, this should not be for you.
yeah.
Say that again.
If you are HIV positive, you are taking your medications, you should not use self-test kit. Because so you say self-test kit is going to give you a false negative result.
Because gana bange do.
So this self-test kit is just like a bait to get people. Because there's I am giving self-test kit, my test, and I am positive. I'll either ways go for treatment. I'll be in denial, blah, blah. But then at some point, I'll go for treatment. But then, so most people will know their HIV status. I'm HIV status. Maybe I'm have sexual intercourse with a lady or anyone. And then, okay, can you get tested? So to you, if I use this as someone that is HIV positive and taking medications, if I use this, I will have a false negative results.
Dara du feeñ.
And then you that is not HIV positive, you have a negative results as well. So if you have a negative results, you will think both of you are negative, when actually the person is actually infected with HIV. Because of the medication that you are taking, that's why you're having a false negative results. So people need to be aware of it. So all of the HIV services are free of charge.
Say that again.
Yes.
Free of charge,
Yes.
as in literally you could get every single aspect of HIV care free of charge. More than it's like an irresponsibility. Man, I really think we should start prosecuting some people that don't want to be on treatment. Because deka bo hamne is very easy for my healthcare.
Again, to be honest,
Yeah.
like we keep on saying, you go to Cardiff General Hospital, for example,
Yes.
you take medications. Gambia, we know each other.
Yeah.
Xam nga Keba xam na Abdoulaye boy ngeen dem teg leen ci benn rang
Exactly.
su boobee ngoon ñu toog di xaar kenn benn comme next du pour HIV nañ ko waxante.
Next, no. They do not call next, they call your name.
Yeah, exactly.
So
ñëpp Gambia bi xam nañ ne tey Keba fa ñu ci HIV medication kooku du ñëw.
sometimes da nga gis kenn like mu ñëw pour jël garabam mu toog foofu noonu mu daw mu dem ba feneen. toog in a different side. mu xaar ba ñëpp wàññeeku mu yoot ñëw. mu ñëw dugga si.
So it's the access. The way you deliver care be more what a change.
Yes.
I think it just needs to change. But also for people to know, Bugana need them from a historical timeline, like in terms of Kanlen identified first HIV case in Gambia around 1985, I don't know. And then we'll talk about the two different types of HIV because I'm the HIV 1, I'm the HIV 2, te Gambia, I'm the Nyohamne, it's dual infection with both. Wayange gets prevalence be as well too, where in the beginning, in the 90s, HIV 2 more outnumbered HIV 1. And then switch bidodi happened. Around the early 2000s, then emergence of HIV 1. Mugena yoko. Te lugena grau si lolo moy. Yange gis mixed epidemic, both 1 and 2. Emergence of HIV 1, right? Shifts in patterns. Te lugena grau si lolo moy li, right? HIV 1 versus HIV 2. Li mung la jox the disease progression, different stages, right? HIV 1 is more aggressive and is higher transmission. Meaning Gambia bu HIV prevalence be Dore 1, the slower progression, lower viral loads more forget on our body. While Legi, the more aggressive one, more get our body. The munglawa typically timeline be, more than the HIV infection is not acquired immune deficiency syndrome, meaning Lee, sa immune system has started shutting down. Mota CD4 count be moneka lunde nate sa soldari yaram bi naka len degere lol len they use pour measure HIV fan la tolo wa mung la wane acute stage 1 of acute infection about 2 to 4 weeks of post infection, right? Meaning yo teranga ko hamne exposure mung fa. Flu like symptoms about 50 to 70% of the cases. Ahdama hawa soch rek suma yaram bi neho suma yaram bangi tanga, right? Viral load is extremely high, right? Meaning, obviously, once again, if you're in that window, temusulo test, nga test rapid kit, it's going to be positive, right? CD4 count temit rapid decline, meaning sa immune system is sasi da fado de hawa crash, right? And infectivity, very high transmission risk, right? Looking at dangerous mo munga survive li fog ne ahdama sojon rek testulo nga transition into clinical latency. Lol mung la wax ne nak li duration bi legui mun nga fa nek for 8 to 10 years. Mungi jonkon rek di la xaar. Right? Typically without treatment, often asymptomatic. This is the most dangerous zone for society, Pullman. Because go yu bari yo xamne wala jigen sa nekulo di test, you have multiple sexual partners or high risk behavior. Mun nga nek in a place where often asymptomatic, dara jotula. Right? But gradual decline, right? Treatment obviously impact bi is easy. Lu doctor pardon wax boy bu ñëk bi ñun duñ fola ci l'hôpital bi be tuberculosis, pneumonia, eye yeast infection, because what they call it opportunistic infections. Moy ne jangaro yo xamne dañ dé bay ba nga niw doole ñu attaque. Xamel sa soldari yaram yi dañoo xaar be soldari soné nañ ñu doga folasi. so léegi-léegi ñu bari ñoo xam ne HIV moo tax ñu dee soo gisee seen death report mun ñëw ne pneumonia moo leen rey wala tuberculosis moo leen rey fekka AIDS moo leen yóbbu very 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 important from a clinical perspective waaye lii mu ngi laa wane lii lu ñu war a bàyyi xel la because am na benn slide ma bëggoon a laal tamit lii is very important time period ma la doon wax right xoola bu njëkk bi HIV2 moo ëppoon slower progression not high transmission xoola léegi fu ñu nekk estimates si age bracket bi look at the difference so meaning the risk level is even higher meaning the community is less safe te moo tax suñ dee wax going back to key populations anybody ku nekk di jafel female sex workers or MSM community from seeking care nekkuloo ko di def pour rule and order de it's a public health issue
so yaa ngi ñëw si loolu it should be beyond that because society most times jigéen ñi suñu am xew dañ lay séddaale like they share the knives among them so nit mun na si gaañ jox ko keneen te gars clean ko or sterilize ko any other thing so these are also ways for sharp objects as well yi nga xamante ni mun na koo waalawante ñun ñëpp loolu tax ma ne like we are either infected or affected ñun ñëpp dañ lay am si barbing salons yi and most times like most barbers do not even sterilize their machines so mun nga maa man I am HIV positive nga ma gaaño si so suma si gaañoo keneen ñëw mu toogaat sa kanam time julli ñu bëri du ne am time sterilizer
possible sa yaa ngi
raba keneen ngeen ñëwaat yaa ngi use sometimes they even use the same blade ba loolu dee gaa doo ko ci ñaat so lii yëpp yoon la yi nga xamante ni nit daf ko leen mën a am so moo tax ñi nga xamante ni ñu ngi liggéey si wàllum li nga xamante ni sharps la su clinical settings yi I believe that now they are not doing it like sharing using one sharp injection wala needles on many different people I want to believe that they are not doing it anymore waaye ñi nga xamante ni ñu ngi si barbing salons yi they need to be very mindful because it's as well a gateway to transmit HIV seen barbing salons yi ba pare yéen bu leen di cot you can be infected yow mën ngaa cot nit nga gaañuwaale sa boppa te amuloo ko pom façon feebar a am so sex unfortunately there is PrEP ARVs and PEP so take for example if I am exposed to sex without using condoms or without not being on any preventives within 72 hours I should seek for medical care I should go to I should be tested and then if I am negative I am placed on PEP for 1 month so PEP is post-exposure prophylaxis so PEP is different from PrEP and PEP is different from ARVs
so on that what test we coming for wala naketa or 72 hours you exposure soto so what test we pour ka koinde o pour foi ba soto la mari bulle bang fo ka itandilo non ima soto non janni o pengo betarle
so expert ñu ngi si PEP because dama bëggoon ñu faran fàcceel si ñoo xam ne dégguñ English right as in lu mooy wax mooy like garab yi dañ dee utee am na yoo xam ne post exposure prophylaxis la loo moo mel ni boo xam ne su nekkee yow am nga contact o loo xam ne mun na laa jox AIDS ba léegi mun ngaa am some kind of fankante mechanism in place boo xam ne garab la dafa mel ni man prime example in the USA musoon naa war a jël PEP because dama doon inject nit vaccination may koo génnee si maire bi loxoom bi mu dóor pengu bu super jala ñëw dugga suma tànka bi comme javelin so immediately bu ma demee si lopitaan bi they put me on PEP because xamuñu woon status si maire bi even though man xamoon naa suma status but yaa ngee njëkkalantu just in case mechanism. It's almost like an insurance mechanism. So what do I mean by post-exposure prophylaxis?
So if anyone out there is like exposed to unprotected sexual intercourse or without any form of preventives, they should seek within 72 hours. They should seek PEP.
Including rape victims, by the way.
Yes. Yeah, it's given to most sexual assault victims.
Yeah.
So just you can either walk to Univax or any other hospital and be like, I am exposed to sex. But make sure it's not beyond 72 hours.
Yes.
Within 72 hours.
Yes.
So if it goes beyond 72 hours, then there's no need for it.
Definitely plan B, right?
Yeah.
It's the same mechanism.
Yeah. So if you are giving PEP for 1 month, after that, they advise you to go for PrEP. If you know that you are sexually active. So there are different ways of taking these medications.
te moo tax ñu ne post exposure mooy xew na ba pare bul toog nag
do not trust anyone.
bul trust kenn
Do not.
te xam nga léegi ñun ñëpp dem nañ fa
No, thanks to my nan.
déedéet waaye ñun ñëpp dem nañ fa condom bi toj na
Yeah.
yaa ngi toog di weeje right because at that point xam nga lu leen nekk si xel bi nekkul rafetaay jigéen ñi ñëpp xam nañ loolu dara boobu taar bi daf dee dem completely feeling bi yëpp dem na yaa ngi xalaat ne ok scare number 1 bëgguma mu biir right te góor yi dañ lay wane suma pulaat game be strong ma ne ba léegi
Ma just see Lolo place.
yeah
So with my work experience, I believe most people are using condoms because bugunta biral.
thank you
This is information I got from a lot of people.
That's true.
Most especially my mates.
yeah
The young adults. Tell you that I use condom because buguma biral.
moo tax family planning
Coming down to that, yes. The thing is, most people, I don't know if you guys have any idea of female proposing anal sex. Either
We're gonna
accept
hit-
it or do not accept. These are happening.
dégg loolu ma
Omar
lu wax ni kee wax ñëwaatal
loolu mu ngi am si dëkk bi
dëkk bi fii
bu dee fooy ne digital rectal exam rek la góor yi nekk di am
No, even without that, so I say that even with now porn,
yeah
female having anal sex. They're having anal sex.
ci dëkk bi fii
xam nga wax boobu la ñu war a bàyyi nag si dëkk bi fii fees bi te
What someone is doing behind, like in closed doors, you do not
Nobody
know. I
have.
do not know. Ismaila doesn't know. Anyone doesn't know.
wax naa la man suma bopp rek laa mun a verify
So these are things that are happening because ñu bëri dañ le rusa waxtaanee lii wala ñu bëri dañ le because there was a conversation I was having with someone. Mi ne ma moom doyam bi virgin la. So the only satisfaction that they have is through
te dégg nga lu mu wax
kooku du bàjjen
déedéet why because déedéet
kooku bokk suma team bi la
déedéet
xam nga
kooku si hymen crew bi la
Yes.
bokk waaye du bàjjen
like because society bu nekk de like at the end of the day bés bu la guys nga say nga dem muura na they want to know if you're a virgin. So most people if they do not want to have vaginal sex they have anal sex. And this is happening. These are conversations that you know that we are not actually ready to have it.
te pako yaa ngi ko nangu
mi pako yaa ko nangu pako
ñu paccax lañ waaye dog booy waaye dëgg booy
proposal bi parce que bañ nga.
ci bi moo la ko
am
proposé
na yeneen pako yi ñoom si seen bopp ñoom ñooy juutu nga ne ma ak seen jigéen ñi nga ne ma
non waaye dog loolu understand naa pako bi
Déedéet, naka nga mën a understand
waaye yow
loolu?
pako yow dëgg dog naka nga laa sa cepe di la waxaa ne du ma ko def fii def ko
Omar,
yow tamit nga ko
Omar.
def
Do you know?
don't be in denial
Omar ñanta sonna ko kilin na le
mun a wati
ke dol bi je ni la ke ya wulta wala ke control at that point itol buka fengo fenje na manke ke ji dorong
I just
su
hope
gisee
like,
paxi béy sax dañ ko faa dugal
Yeah.
exactly
Jala bu ngay naan just pair like these Viagra's and stuff.
aha
nga ñëw suuf ñu ne la booy tey game bi du baax. fekk yaa ngi naan ba
I
pare.
don't know if you are aware that like most men or some men, let me use some, they gain their satisfaction through anal, like playing with their anal.
xam nga ñu ngi ko fi doon wax nit ñi ni li ni Amar yaa ngi noppi tey
man koy waxtaan leen
ya comme nga fay ñamen dron ya ñele ni ke ya ñil lota yelo men kata kungoto adobi jaka direct wolto so afanan ke fansu ake mira fa wayen e ka fo at that point it has its own brain
doo bañ dara doo siilu dara
Even with porns now, you're seeing it.
non wa dëgg la di
Are seeing
But
it.
anal sex is a big thing, bro. You know about it.
boy
People might not come openly to you to be like, I'm having anal sex, but they might be having it.
wala ñu ne la yaa dañ nekk di am pile
waaye la suma
ne
la
hemorrhoids non dëgg la di non but it's true yow kilifa mun naa ñëw gis docteur Pa
moo tax paal bëri léegi
déedéet man moom
feebar bi bëri na feebari paal bëri na yéen a ngi soog a wax nag garab bi paal du dee taxaw
No, so now we are not saying
du dee
that.
taxaw
non waaye lu ma wax dëgg la de
du dee taxaw garab bi paal du dee taxaw garab bi paal du dee taxaw
déedéet waaye some people have hemorrhoids though Omar
réew bi jaxasoo na
waaye xam nga ne yow kilifa du dem toog dajee docteur Pa si lopitaan
waaw
ah magam jëmma
waaw
bugga nettali docteur Pa ne lii daal du hemorrhoids nii la fa taajoo loolu fan la ko nettale no but it's true though
Yeah, it is,
ba xam nga
yeah.
ñun suñu society lu ñu war a bàyyi lii mu ngi fay am
Neko di house
lii nekku si dëkk bi lii fii dëkki jullit bii liñ bàyyi di def loolu Because problem before they door people have very weird sexual proclivities.
Like before we start, someone was saying about Augie. Augie sex, right? Having sex with like
Multiple
many
people.
multiple people. These are things that are happening.
Like
Gangbangs.
Yeah.
For some.
As in multiple sexual partners.
No. Just
The same encounter.
The same encounter.
You have so many people.
No, I mean, Monica, then I guess sometimes either threesome scene wala group sex.
So benn góor
benn néeg.
beneen néeg nga gis jigéen yu bari góor yu
bari.
kii nekk kii dugal fii kii dugal fii kii dugal fii boobu loo ci wax
à la carte.
boobu loo ci wax see
these are things happening.
Omar, we are in an environment, we are in a generation we said it in the last episode, that many people's exposure to sex is pornography.
It is.
Yes.
Foofu lañ jàngee lu bari.
Da ngay gis dara nga bëgg try.
Yes, and they want to try. People are trying.
And it's not real life.
So this is the problem. That is why this thing in the porn is happening in real life.
Te xam nga exposure. No, it's human beings. Xam nga moo tax yéen even ñu bari dañ la ne bu fa dem. So for them, one way street like that.
So many HIV, like you can have it through many ways.
Yeah.
You can have it through anal sex, and you can have it like as far as there's any form of penetration, you can have it. Now, like young adult about anal sex, but how many of us engage in oral sex?
Last episode when you got Rufa Tufa. We talked about it. Then you body name once again virgin law, quote unquote, both men and women, some massy.
Yeah.
But yow yaa braay wu ñëw te bii ngeen so nga waroon na soo ñëw
topic bi ngeen so la waroon na
no but it's true because society bi am nga once again ñu bari virginity means something to them not based on their character based on their viability for marriage nañ waxante dëgg so and family pressure that's true so they'll alternate all these things that are really sexual activities that are still high risk in the name of virginity so do fensa su nekkee yow you've been exposed to anal sex, oral sex, ba pare nga sëy at 30 sa jëkkër mën na la nax téye nga sa bopp nga ne ko waaw musuma I've never had penetrative sex fenuloo waaw xam nga completely la wax bi
waaw leerul
right so su nekkee
non moom lu mu la laajte rek nga answer
déedéet waaye dëgg la di ba pare we should even run away from this whole hymen test because some women don't have hymens or it's not intact so loolu we need to go away from that I don't think maybe it's still happening in 2025 bëgguma wax ak ñëpp but the reality is just the exposure is high but most important thing luñ fi wax mooy there are mechanisms in place in terms of PEP but also pre-exposure prophylaxis meaning yow xam nga ne bala ngaa dugga si yooy dugga aaral sa boppa in more ways than just a condom.
So yes, more ways than just a condom. So said that currently PrEP, pre-exposure prophylaxis, it's only available with Innovax, like the mobile clinics. It's only available with Innovax at the moment because it's an expensive medication.
Yeah.
So if you know you are sexually active, maybe in a week I'm sex 3 to 4 times or maybe more.
And sometimes with multiple partners.
Yeah, sometimes you can have condom burst.
No, you just take it every single day.
Yes.
It's like, listen.
No, you can take it every single day depending on your exposure. But then too, you can take it in a way, you can only take it when you're having sex. So, Tuesday.
Tuesday, yeah.
So I plan on having sex Tuesday. When I'm in sex. So before reaching my destination or before having sex, I'm going to take 2. So, okay, Balalolo, sorry. PrEP is only meant for HIV negative person.
Yes.
You are HIV negative, you are a PrEP.
So meaning, as in, kuko nan, for what I fake yo amulo HIV positive status.
You have already gotten tested.
Why is that?
Yes, right. Because different medications.
Because if it was positive, you need to be on treatment.
Right. Another medication.
Which is another medication. Right?
So PrEP is only meant for someone that is HIV negative.
Yeah.
So PrEP is available in this country.
Chesa mu ngi am interest ci wax bi ni.
Chesa knowledge bi la. But the streets need to know. No, dëgg la.
Chesa yow di nga concentrate ci episode bi.
There was a time I did an advocacy like I'm gonna show it around like taking pictures of HIV advocacy and then lots of people I just posted it on Instagram and Facebook and a lot of people reach out to be like Keba, I don't know condom available in this country. So this is just one.
For free?
Yes. And then this you can show it, I don't mind. So people reach out to be like Keba, I don't know this available. Some people even later text me on this app to be like nakala ñu mitem am condom because I'm Jerusalem jëne ci condom.
So ñaata boy ñoo Rusa?
Yes. Ngamera.
Lele ngamera bala nga duga fofu in your single days. Yeah. Did you always have a condom on you? When you know sexual activity might be possible?
No, I don't do those kind of stuff. So you
tell me virgin nga won bese.
Ndolbe bota solo kono. Ndolbe bota solo kono.
Am gayna.
Janne nafudu sito ala yalon. Mbem fambulu. Mbe ke Omar Fongo safa de gor yalla la won.
Alhamdulillah.
Ngamera ke baye men fo wala kondomo la karola. Toñalo mol kam malu bakele kata ka kondomo ta. O fanan dabe ko kono me ala ko pour ka kondomo la distribution wala mol ya soto ak kolia. Katung ikaje adinya bari kampoto comme nga fanya ndengan na life bega kampoto wala system wala soto because there was some time a wifi soto no sojar loptano nyinto je nkata je clinicals lanu suto ani nkata study ka nyola fananje so nkata ma ko nyola je wata am taka nursing school so wero bi jele me alon ko wero ni be konoto membe banta e ko jele bari membe banta bu kete je konoto so it all initially system moment soto basket wala bi je e ka kondomo ke basket wala kono den ya sorong sa nite natare momo natare ementa so funnily comme mol kata nyama ka foni wa kele fang e ka doje la ay nanang ay keten a fanke ko men ka tambi ay amera mo baje ay tambi so ay confirm mo mandara sirinje ay murun nang ay basketo jibe ay bi a kala poso kono dol bije katale fang ngamere hakilo yama he yamara ndata la kari nin kari fana yo murun nang ko tanke ya bi ko tanke ake post do kono yeta so e ka ngani nin karo ke ka fanyo ko som tumondo ni yake je suto fitiro janning asamo gatara banda fereng so wala ka itandi la mol kala falale bari asoto nyaay ka malle kata ka nyinin karo ka fo docteur baji ande sulata nyina le aballa janne so akumata bakila adi nya dol bije nabe laring isa cikanu bari mol be sirinjela wala mol bije karo loptano lo mol ka siajel doro be malla katata wadama damma se bulano ko kono me alon ko yeta ni muso e kafu wala ni ke kafu warra woman kondo modu wala tol madum yena nyin sa soto so wala na kumata bakele akadi nyamen anda kalandi dame mol ba tanu la nyaay ba soto lo la nyaam warra ime discriminate akumara bakele.
So let me ask you guys a question. So is it an issue of gori mununyo jotsi condom or gori bugun disol condom?
I think bit of both.
Ñaari yep.
Bit of both.
Okay. Secondary question. Is it the responsibility of the guy to always keep condoms around or the female to keep condoms around?
It's both.
Mo fulol mume.
I think
Both.
Where is it the safest? Who is more likely to present a condom all the time if they have some?
I think female.
Go bare them or jigen bare them?
It depends.
Whose responsibility is it?
Nka doko ke pharmacy ngoto dem. Kondomo jama ke wolle kasan. Wolle kana kasan. But when it comes to 72 hours or musol lek
But who makes it available? Hamga jigen agents and you don't want me to consent. We had a heated debate. Hamga consent muna wane wa am. Hamga lolo communication. Hamga boy ma condom de. Boy you bari excuse bubble and they use. Duñ faté lu nekk nañ faté lu nekk way condom bi nañ ko faté. Wa hamga so agé kok muna la wa amar am.
Doc.
No, do not be using it with your mouth.
no mag na
ñu ngeen ñëw ci loolu sax xam nga lu ñuy def ci exercise
no jokko kele
non yow demonstration
no dog ñaan naa la rek mo dugal
ñu ngi doon wane butéel bi la ñoo use
So
as
is it the same
experiment.
as the what is the brand? Those brands that they sell in the supermarket?
Durex.
Durex.
Is it
Yes.
the
No,
same quality?
This is stronger. It's different quality, I want to believe. So with Durex, with the condoms that are sold at the pharmacies have different flavors,
Banana.
different types, different sizes, and so.
So like more advantage of using this over the bowl,
I feel like as far as there is condom, use it. So there's no disadvantage or advantage to it.
It's just preference.
Yes.
Right, it's still available. But
why are you advocating for male condoms and not female?
No, there are female condoms. Actually, I was to bring it, but then it was out of stock when I was leaving the office.
availability, and that the fact that it's easier to access a condom, a male condom, than a female condom.
No, but a female condom is a bit complicated on how to wear it.
How to wear it.
Because don't cover that twist, just put it inside of you.
Yeah.
And then if you are pulling it out, you need to be very mindful.
Spillage, munna.
So like using the male condom is more easier.
Yeah.
So coming back to the female sex workers. So I have a conversation with most of the female sex workers. Guys, then we have customers that you know that they prefer raw sex. And they pay them more. So they will use the female condom, insert it in them. So you, the man, you would think that you're going raw. When deep down, there is a condom in it.
Boy,
No, I'm fine for like. I'm looking at this. Then you know what, Lolo? Mala one.
I mean, in medical school, the female condom, what we taught us, one of the major advantages is more the control that they have as females.
Yes.
You can.
So I think female condoms, even like most people do not know about it.
Anybody must go get
So mostly it's like foreigners that comes to that knows more about it. Because I said like so most of the time it's just the foreigners coming out to get tested.
Yeah.
So these are the things that they use. Like now most of them are even on PrEP because they will get tested and then they will tell you sometimes I have a sexual intercourse with someone koku down by deret la gene. Wala ñu am sex wala koku nonu mu nan garab because most of them dañ lay ñew pour saware guy. So they drink Viagra and others. So they are there to work. So like in one night, in one night, they are meeting with different men.
Up to how many nights?
It depends.
Yeah.
It depends no taro, no mel and every other thing.
ñeneen ñi da nga nekk si projet du dóor sa ñu ngi wax client ade come wait for me ade come dama ko gaay
dama la challenge lu tax nga ne ade kam te xoloo ne xaar ma maa ngi ñëw
non waaye comme waa saay wax
waaye
ñu gaay ñi ngeen laaxatu ñu ko def ko dañu laaxatu fii yow dog man sax mun naa am cepe boo xamee ne night walk la te duma ko xam
te female sex workers nekkul there's unofficial there's rumors ba pare koñ bu nekk xam nañ ne am na ñu fa nekk
right
nu mu fa demee nu mu fa taajoo mu fa
ma ñëw si loolu tuuti because ñun ñu bëri soo laajtee ñan noo sex workers ñu ngi ko lay jaay moo nekk ñuy taxawaalu si mbedd but then how many of us like are having sex with ladies that are willing to charge us, that we call our girlfriends, or those that we meet at the clubs. Or
iPhone.
Like just yesterday, I saw a post of a lady. The husband is abroad. Why can I move
Yeah, the one at Farato, right?
No, tell So how many ladies out there? Julie mga jot si yaay soxla yere Julie. Nga ne góor bi kaay ñu tasee. Like let's have sex and then you pay me this amount.
Te gala bi sax.
Pour dem defit. Most of these when
na wale seka di ñëw wala Youssou Ndour rek nga seet.
So society bu nekk they only categorize génn ak
promotions and offices so hala.
Yes, exactly. Just people like as far as you're having sex for for an exchange of something, like I believe you are a sex worker. So you just need to like dafa am sex workers yi nga xam ne ñu ngi si biir kër yi ak ñi nekk si biti dafa nekk ñu nekk si biti ñoo gën a ñeme rek pour génn
ma ne te góor yi sax
am bëri like maa ko waxoon aade suma mbaraan bi te mbaraan bi nga am
ma ne koto yi bari sax ñoo ko dee officialize doo dee dang dee jox hit na nit ki sax doo ko bugg a bàyyi mu label ko loolu waaye yow koto bi soo xamee ne saa yu nekk yaa ngee joxe baxa in exchange for something. So yage mom jarutut muy la charge price. It's already understood that this is transactional. Right. Because the concept is just transactional sex.
So so there are not only female sex workers, there are male sex workers.
Yeah, gigolos, right?
Gigolos.
So say the tourism season so Ibe. Most of our brothers are out there having sex with like the tourists coming into this country. What are they getting? What are they having in return?
Money.
Yeah.
Money or opportunities.
Promise of okay.
Yes.
Okay.
So all of this, I'm not saying all tourists that are coming to this country are here for sex, but then most of the time,
Gambia is the paradise for sex.
They talk about Gambia in terms of
They talk about it. So society, most of the time, the bumpsters at the beach, even not the bumpsters, people that are meeting on dating apps, Tinder and every other thing. You are meeting there. Okay, are you agreeing on the, well, I feel my passport and you pay me this? Or I'm meeting a tourist there, or I'm meeting a white person. Well, I think I'm going to fee. So, okay, it's when you like to have sex with you, how much are you paying me? So these are all things, these are all things that are happening.
There's nothing free in this world. Kula foog ne dafa tëddee for free.
Yeah.
Yow sa taar àggut foofu. Ak sa confidence àggut foofu. The reality is, but xam nga lu gën a troubling mooy, men, we're so problematic léegi society. Xalaatal yow nga ñëw, you're wanting to pay more money to have unprotected sex. So the economy of sex is based on monetary value. Su nekkee ne yow amuloo client the whole day, nit ñëw xamuloo fan la jógee, mu offer la price 10 nit just to have sex unprotected.
So, yes.
What are you going to do?
Papa, most society, so I'm engagement with these ladies. Then they want to send span night, look at what I face and logi. It's expensive.
It's pimping.
Yeah.
Danga luwe. How many keep
I think it's increased.
Business bit.
Because there was a time how I said looking what some guy posted about, I think City Pop, no long send girls, you don't complain, they got an increase.
They increased
2008, how much 2000?
Landlord.
Yeah. No, but that's the economy though.
Bahna's a guy.
Huh? Yeah,
No, I do not believe that Bahnasi guy, because you know what happened? It's our own brothers. It's us that is
for
doing
them.
these
So
people.
you send Kiliani.
Lunity what I understand, Monica, today if I am tested positive for HIV, Muna walk into anyone, okay, I am sex with someone, put infect her. But then there are a lot of consequences that come with it.
Yeah.
So Suneka, I am tested positive today, and I'm just HIV-1. If I am actually HIV-1, like Dr. mentioned earlier, there are different types of HIV. If I am HIV-1, I can be like, I'm going to have sex with someone, because most people will do this.
Yep.
Well, partners have sex, and then they are one of them is tested positive, and they happen to have sex with, like, they will not tell the partner that I'm positive. So as someone like that is positive for HIV, I can be like, I'm going to infect other people. So you that is going there, you do not know who you want to have sex with, what type of HIV the person have. So you thinking that you're going to do something bad to someone while putting yourself more at risk. Because I can leave my house being like, okay, I'm going to meet my partner, and happen to have sex with my partner while my partner is HIV too. I do not know. Because with HIV, you cannot point a finger and be like, if I'm HIV, this person is HIV positive or not.
Nope.
The only time that you know that someone has HIV is through testing.
Yeah, that's it.
Sometimes you will see some people come into the clinic, like you might see symptoms, but you will not be sure unless you do a test.
Yeah.
So people need to be very mindful. If you know your HIV status and or not, you are not, and you are undetectable, make sure that you practice safer sex. Or if you are to have sexual intercourse, make sure the person that you're having sex with or wanting to have sex with is tested and the person is negative.
And how many of us
To protect
do that?
yourself and to protect the person. So it's important that we are going back to get tested. Like, it's free, it's safe. You do not need to worry. Like, as I mentioned earlier, like the male vitality program that they can come in. If you know you're a man and then feel like you want to come in like every Sunday, just walk in and come. Get yourself sorted out and be on the safer side. No one knows what you are here for. Get your HIV testing done, all of the other STIs, get your medication, and you're good to go.
Right.
These are the things that we need to do. And we hanga jigeni sa den letane, because jigeni at some point they let them lopitan. Because now every pregnant woman is tested.
Right.
Because they are trying to protect this woman not to infect the child.
Yep.
Understand?
Yep.
So as someone ki nga xamanteni yow goor bi, it's ñu no nek problem bi.
Yep.
We hardly go out for testing.
Yep.
We hardly do this.
Yep.
And then sometimes su nekk dara jot na rek we start pointing fingers at ladies. Oh, yaa ma ko jox wala toogulo or any other thing.
No, hold on, rek.
So
Gambia. Wax naa la ñun kenn mun nga ñoo yab de waaye si antenatal services Gambia.
Yep.
Doo ñu mun a yab. Loolu moom I talk about it all the time. 98% PMTCT linkage rate in terms of pregnant women preventing mother-to-child transmission. 98%. There is no behavior that's contingent on men, Gambian men. That is 98%.
can I come to that?
Yeah.
Okay. So what I was saying earlier, Suneke as a lady or a woman, you are positive for HIV and you are taking your medications correctly. You cannot infect the virus to your child through pregnancy, delivery, or breastfeeding. Because if you are positive, you can infect the virus if you are positive and not taking medications, you can infect the virus to the child through pregnancy, delivery, or breastfeeding. But then if you are taking your medication as someone that's HIV positive, then you cannot, or there's less likely for you to infect the virus to the child through pregnancy, delivery, or breastfeeding. But most children that are born to HIV parents, soon, if they are out there giving medications, I think syrup, I forgot the name of the syrup, but they are giving medications just to be on the safer side. So I'm not saying at all instances like, you guys are put numbers and they're HIV positive. No. But to make you as a mother, you are not taking your medications correctly, and then your viral load is high, you should not breastfeed your child.
Yeah.
Because so neke angen nampa sa dom, le dinga muna infect sa dom.
Yep.
There was a sad, I came across a 10 to 12-year-old child that was taking medications. So I did a background check on the child. Both the parents are negative. The mother is negative, the father is negative. But I was so concerned that how is the child positive for HIV? I'm not sure, but it comes down to sharps. It could be sharps or it could be anything. But I tried asking the nurse that have been seeing him. He said both parents are negative and then they just do not know.
Yes, there's also another practice here that we don't talk about is that mom bisiket with nampal haleb.
Yes.
What is that?
Yeah, you know, yeah, people.
Yeah,
you
a wet mother.
Wet mother.
Yeah, wet mother.
Looking after the child.
Right.
How come we talk about men having sex with men and then Omar was like, hey, that's not happening. I want to believe, yeah? Can you remember there was a 12-year-old boy around Canifin that was raped? This was some years back.
Yep.
Who got raped? Makla?
Magla.
Yes.
Yeah.
The one that raped him is an adult. Like, now tell me, what is the man gaining that pleasure from a 12-year-old boy?
It's a society we live
No,
in.
molbe sasaren le. People are sick.
Ismine du sasa.
Mane, the sasare.
No,
Pale ne wane ni den febar.
no, it's mentally.
Dede, xam nga lu tax ma ne buñ ko oyee feebar. Doomi Adama, I feel like am na yenn exposure yi that they change your brain, how it sees morality, what's right from wrong, your pleasure systems. It's not a sickness. Because yaa ngi excuse behavior boo xam ne waruñ ko just discount to sickness because people ñoo xam ne they're really struggling with mental issues. Half the times sex is the last thing on their mind.
I agree.
So we could just discount them. Men are sick. No. People have some
What
sexual.
people do behind in closed doors, you do not know.
No, you don't know.
Amanke kewol damati.
But I meant to say attitude.
Ikajele mol bije they gain their pleasures from different things. Even cops. They only have pleasure when they sleep with cops.
Yeah.
So at that point, woman can there. Amanke pleasure damati because
Do you know the price of dildo have increased? All has risen.
Yeah.
So people are using it all.
And
They're getting all of this for satisfaction.
yeah, but also, wait, Mirmidal. Anyways, let's come back to HIV. Condom. First of all, who's getting tested today?
Will give.
Yes.
How effective is this testing?
It's very effective.
And also, with regards to the female condom, I don't know how it is used, but what is the possibility of it going inside the woman?
The design.
It's in a two open format.
Yeah.
Two open in Islam. Yeah, you can.
So there are instances where you have scenarios where condoms getting stuck in there. Again, many people don't know how to put on condoms to start with. But we need to understand the female track B. It's like a pipe, and you've got the cervix on top there, so nothing can go past the cervix.
Yeah.
They just go and get stuck up around the cervix area there.
This is what I asked, is because I watched the video, I don't know, some time back, they said the woman condom got stuck in her, I don't know.
A regular condom.
Yes.
Yeah. Well, that may happen.
So
Condom
as a man, if you're wearing condoms, but you do not wear it correctly, when having sex, the condom can be pulled off.
Yeah.
Understand?
A good practice in the act, always bring it back down.
Yes.
Because
most people cannot wear condoms.
Yeah.
Or some people cannot wear condoms.
Well, you lose your erection. And it's likely for you to lose a condom when you lose your erection.
It's one solid condom, I'm losing my erection.
Yeah.
So all of
you
this
get tested, Amar.
Anyways, I'm asking for the viewers.
Huh?
The data you projected before about the HIV 1 and 2,
Yes.
it showed the number of people that you guys tested. So how did you get the percentage?
These
These are data from the country.
The data from the country.
Okay, but you need to know like how many, is it population of the people or the population that are tested?
Which percentage?
No, the other one. The one with the HIV 1, yes. This one.
So this is from 2024, the National AIDS Secretariat report.
Yes.
That's the testing break.
How do you get percentage every 1, 2, 3? Because you need a total number. So what are those total number from?
Where country be? So what you do is you get the people that are tested positive to the population of the country. So low prevalence. If we now take this room, is how many of us here? 10 of us here. We test all of us. 2 are positive. 2 out of 10 is what? 2 out of 10 is 1%. So it's a 1% of.
For example, how many no, look at what
Because if you just put numbers, for me, I won't understand the numbers.
Okay.
You tell me the number of.
Okay, so let me guide you. 2024, we had 2,711 new cases identified in the Gambia, meaning all new tests. We identified 2,711 Gambians that tested positive for HIV last year, right? Out of that, 92% of them were HIV-1, meaning that was the more aggressive one. And then HIV-2 was 7% of them, and we had 1% of this 2,711 that was dual, both HIV-1 and HIV-2. Now you understand? So munglawa almost 3,000 nit ñoo am HIV last year. Bir Gambia fi. Out of lolu, 2,488 HIV type 1 lañ am, which is the more aggressive one. And then out of that, 183 cases ñoo nekk HIV type 2, right? Why munglawa out of these linked to care, meaning su ñi ñu positive, this amount linked to care as in complete name, belegi door name, the treatment. Hamga HIV care, it's almost like capture and keep. Testing be, you come from nenga positive. Telol hamga co-equal ownership of treatment is important. Then kore wa bir Innovarex. Then everybody watching, Keba is a social worker for Innovarex. So even in terms of HIV care, the hardest part is convincing people, okay, li, moist situation from nekani. Funga door care. Right? So you may succeed connecting those people. Out of this, 461 pregnant women were found to be HIV positive. Because during pregnancy, then they screen jigeni pull HIV. And out of those, 98% of this 461 len dodi protect. So data below what I say. So the challenge is next year. Number B, Muyoko, there's trouble in paradise. Right? Well, as soon as number B, it stays the same, about let's say 3,000 new cases. Why you get struggle pulling people to care? More than swing dore one, yung la one, 95, 95, 95 is the goal. 95% of the people know their status. 95% of the people who know their status are on antiretroviral therapy. Moy garapi HIV. And then out of those, then 95% of them know hamne send viral load is suppressed because in HIV then they want lo hamne U equals U.
Yes.
Right? Lee, very important. Meaning undetectable equals untransmittable. U equals U munglawane so do re di jël sa garapi. Noko ware. Sa viral load bi do de muna gis HIV si sa deret bi. It's undetectable, so ko testé do ko gis. So lol mu ngi la wane so ko gisute, even so amé unprotected sex ako xamné amul HIV, yaa ngi minimize the risk of transmission. That's the goal. While lol pour nga aga fi obviously linked to care, immediate treatment. Suñ testé positive, nga waxtaan be nangu, ñu door la on medication. Medication become diabetes te naa ñëw si final slides because dama am comparison. So dooree di jël garabi HIV. Every so often dañ war di check sa viral load si fan la tooru. Xam nga maa doon ne viral load si ñu ngi laa wane ok fan nga toll in terms of ñaata HIV moo nekk si sa deret bi. Because garab bi daf ko war a wàññi. So yow su nekkee every single month Keba mu ngi laa jox sa garab bi sa viral load bi warta nekk di yokku. Loolu mu ngi woon nit ne nekkuloo di jël sa garab bi. Mooy tracking bi ba pare moo tax ñu ne adherence is very important. te moo tax ñun dañ war a gestuwaat suñ boppa because dëkk yu bari dangaa fay pour garab. Gambia is one of the countries yoo xam ne garab is free of charge. Meaning duñ la caay dara pour nga àgga into U equals U. waaye su nekkee ne da nga bañ a start treatment wala di am denial ne damaa dem si sëriñ bi or X, Y, and Z, you are at so much risk to the general population because of that.
Yeah.
So U equals to you does not mean that you are negative.
Yes.
So if you are tested and you're positive, if you are taking your medications within 1 year, you can be undetectable.
Yeah.
So if you are undetectable, this doesn't mean that you are negative. Because HIV medication is a lifelong treatment.
Yep.
These medications do not cure, they are treatment.
Yep.
So these treatments are to control the virus in your body, not to multiply. Because what the HIV does is, if it enters your body, it multiplies and it affects your white blood cells, like the T cells. So as it goes, your T cells will start collapsing slowly. So that's why HIV can live. I don't know if you know this, if you can remember the slogan. You can live, malaria is deadlier than HIV. Because HIV, you can live with it for many years. You will not know and you will look healthy and every other thing. But then deep down, you are HIV positive.
Yep.
So if anyone is tested for positive HIV and they are positive and they are taking their medication and they are told that they are undetectable, this does not mean that they should stop their treatment.
Yes.
You should continue taking your medications because any day that you stop taking your medications, it will bring further complications for you. Because next week, later on, the medication will cause resistance in your system. Now, instead of the medication helping you, the medication will no longer help you. So that's why anyone that is positive for HIV, they should adhere to their medications, correctly taking it all the time, avoiding skipping of it, and then making sure that they are practicing safer sex. But then knowing too that you are not negative.
Yeah.
If you are tested with the syphilis duo, it will still show that you are positive. But then if you are bleed and then taken to the lab, it will show that your viral particles in your body are low to an extent that you are less likely to transmit the virus to someone else. So that's U equals to. Because I guess sometimes, like fever with a be like, one yakuna, then you find that they are cured. So then you buy them at different activities or any other thing.
Yeah.
Recently, I had a client, like, he's undetectable, can he go and have sex without condoms? So I just explained to him the risk that comes with it.
Yep.
Because the next person that you're having sex with, you're hamulokogostirosam. So it's important that we are protecting ourselves because you can have dual infections.
Yep.
That is HIV-3. Today, if I am HIV-1, I happen to have sexual intercourse with someone that is HIV-2. Maybe I am taking my medication, but the person that I'm having sex with is not taking his medication or her medications. So if this person is not taking the medications and I happen to have sex with this person can infect me with its too.
Yep.
With its HIV-2. So now instead of just having HIV-1, I'm just going to have HIV-3 in my body. I'm going to have a combination of HIV-1 and HIV-2. So it's either anal sex, vaginal sex, or oral sex. We need to be practicing safer sex. Yes.
So
how what?
I think
When abstinence is the key. Musulodega ko abstain ko
yes, so I think just trying to put myself in the person that asked the question that said that me being undetectable, can I have unprotected sex? So for example, if I'm having sex with someone that is negative for sure,
Yes.
and is undetectable for me, does that mean I'm gonna transfer it to that
You are
person?
less likely to transmit
less
the virus.
likely.
Yes, untransferable. So is it the same machine that tests undetected, that tests for negative, or is there a different machine that tests for?
So with HIV kits, there are different HIV kits. Someone, like I mentioned earlier, someone that never done HIV test, that have never done HIV test, or someone that does not know their HIV status. Man, you are not positive for HIV, you can use the self-test kit, and it's going to give you a valid result. So if, for example, I am HIV positive, if I use this test kit, if I'm HIV positive and I'm taking my medications, if I use this self-test kit, it's going to give me a negative result. A false negative result. Because the medication that you are taking, it's working effectively in your body.
Yep.
If you use this. But then if you test with the syphilis duo, so then you have 20 years, if you test, you are still positive.
Yep.
With the syphilis duo. That one is way advanced than this.
Yeah.
So this is like the self-test kit is a bait to catch people that you know that, or to bring people forward that you know they have used this and get tested and they are negative and they are positive. Because as soon as I get tested now and I am positive, I will be in denial. But at some point I will know I'm positive and I need to go and seek treatment.
Yeah.
Even if I am in denial, now because they might confirm with another hospital if I am actually positive.
And you
So that's why they are self-test kits. Because have you ever tested for HIV?
You haven't?
No.
You want to
Because
do it now?
These are the things. Like most people,
Huh? Yeah, they like it.
most people do not come forward to get tested.
Yeah.
Hanga, like phobia when you have HIV is very big.
It's too big.
I mean, my first test I did when I was second year medical school. Dama lam laahu man kena dafa sama ba test bi dama xam naka la wara ñew.
Do you know that te mun naa test this
I
this
can do
month,
that with it.
the next 3 months ma war a test and clearly know that I do not have any intercourse. Did I still under anxiety or
Anxiety.
something?
Yeah, I mean,
Because how HIV is, but then like it's not something you should worry about or anyone should worry about. There are medications for free. You can live a healthy life. If you are HIV positive, you can take medications for free of charge. You can have a wife or you can get married to a man or a woman, have children without transmitting the virus to your partners and without transmitting the virus to your children. You can do a lot of things. If I am HIV positive today, I can sleep with you on the same bed without transmitting the HIV to you. I can shake hands. We can do anything. We can kiss. We can cuddle. We can do anything. We can eat from the same bowls. We can share the same clothes.
Yeah.
We can be best of friends without transmitting the virus to you. HIV can be transmitted through sexual intercourse, 1, sharing of sharp objects from a mother to a child or blood transfusion. As far as there's any form of like intercourse between 2 people, penetration, and one of them is HIV positive, they can, or either one of them is HIV positive, they can infect each other. While today you are admitted at a hospital and then someone is donating you blood, if the person that is donating you blood is HIV positive and the person's blood is not tested and the person happens to donate blood to you, the person can infect you with the HIV virus.
Yeah.
1. The other is from a mother to a child. If a mother is HIV positive and she's not taking her medications correctly, she can infect the virus to the child through pregnancy, delivery, or breastfeeding. So the other one is salons, sharp objects. We all go to the salons. Sometimes time usually like most of them are very busy that they do not even sterilize their machines and all of things. Like the ladies during festive seasons or ceremonial events, they will share knives, sharp objects together. Well, like because they're in a rush or something. So these are ways that you can only get HIV and oral sex too. But oral sex there is less likely. Yeah. So penetrative sex has a high percentage of being infected with HIV than oral sex. So apart from that, you can kiss with your partners. You can hug. You can kiss with someone that is HIV positive. You can hug. You can even have sex with someone that is HIV positive, and you are whilst you are still protecting yourself. That is, you are using PrEP. Or you are using condoms.
Can you do dip kissing?
Yeah, you can do dip kissing.
No. There's a reason why I asked
you can do dip kissing.
At times.
Like a French kiss.
Huh?
No, you can do dip kissing.
Yeah. No, dip kissing is like.
No, understand.
No. Nekk si gémmiñ bi rek di ko lekk yu and then at times. Exactly. At times it can lead to that, comme maanaam positive yàlla tere. So ma war a like am that dip case with a woman koo xamee ne she is negative. To an extent,
She's positive or negative?
Negative. Man, I'm positive. I just give myself. So at a point, you gagne one and then all of that. So munta neka a risk. Muso neka victim. Dara.
So, but then as far as there's opening on both
opening on both ends.
Yes. Like there can be this. Like what I meant by oral sex is there's when someone has a sore in their mouth and you go oral sex, you are at risk of HIV positive.
Yes.
Either you give a man head or the man is giving you head, bringing down or whatsoever. As far as you have sores, you are putting yourself at risk. But then as far as there is no opening, then you are good to go.
Yes. Keba, come ya fanya ni kewa be kungodi ka muso wala muso be kungodi kan kewa malam fo wala the right word giving head.
Yes.
Ngalon ne kono asido.
Cunnilingus, like fellatio. That's the medical terms.
Okay.
Cunnilingus.
Okay,
Thanks for that.
For a woman and fellatio.
Fellatio for a guy.
For a guy.
Okay. Sa ngalon ne kono asibol bi jele. To nyalon ko mi ya fa nyameng akuma tele pour mol ya lon katun dato da jiola karola a saundo nyola ba kole ala bakele ase keno amari se tarano ase lebulo so no me alon ka sa saundi no le bari amanke coming ni ke woni muso kafte la ke ala ni muso ala karola bari kaje kono asido bi andum kalon ne nanyi jamono be nyamen dol bi je kala file yela ke ya wala la muso ya nyinke da kono sako kewo so ni ala ke ya nyinke da kono fo ala maniyo fintita wala ka fame spam man ni ngol ka fa maniyo ni maniyo fintita aya kunu
Luis spam say Olaf.
Mani. Mani.
Maniw.
non maniw arab la
Ma fa zen. Neko zen.
ah non maniw arab la
waaw waaye olof yi dañ ko dee waaw mani
waaw waaye maniw moom baadi arab
Maniw.
maniw
Like manio. No, la sound.
maniw
Fertilizer.
waaw fertilizer la de waaw continuer
ngalo ne kono ko baramo soto no le bari sain kono nyim fana acide o soto le so o acibol ni menka mol mako pour nga domorol ni jakas no balo kono balo yata fo nga mero wo sem mako no pour kanyin sasa fa bang.
So I once asked someone, Minema, if you swallow the sperm, you are less likely to be infected with HIV. As far as there is no source in your
Sauce
mouth.
in your mouth, yeah.
But if the sperm has passed through your throat bladder and go down to your stomach, I think as you mentioned earlier about the acid whatsoever. So according to the person, there's less likely for HIV to get it through from that. Yes.
Okay.
I have two questions.
Yes.
What are the side effects to the medications?
Yeah.
That's one. And secondly, if I do a withdrawal method, am I still at the chance?
Yes. First of all, two questions. Antiretrovirals in Namabuga last that obviously there's no such thing as medications bomb with side effects.
Yeah.
There are none. There's just none. Even the most common high blood pressure pill, muna neulo satanka.
Jël ka di 72 hours ñu ne amul side effect.
ko leen ko wax
Either way, right? Why luma bëggoon a laal tamit mooy jaxase garab. Si garab HIV la gën a graawe. Wala nga ko jaxas ak herbal medicine.
Yeah.
Gis nga suñ liver bi dafa am enzymes. Yoo xam ne daf day determine garab bi naka la day yaagee sa biir système bi. So am na yoo dee mun a jël. Moo tax dina dee wane sooy jël cholesterol garab bul naan grapefruit juice. Because mun naa yaagaloo garab bi si sa système bi. Meaning suñ liver enzymes yi léegi especially HIV medications then am a high sensitivity towards drug interactions. Moo nekk jaar ñaari garab yu nanguwut. Waaye man lu ma dee wax garab yu bari soo ko dooree di jël foog nga yëg dara sa yaram bi ba sa yaram bi miin ko. So di nga am side effects. Waaye si garab side effects bi risk benefit ratio bi dafa mel ni su la waxee ne sa xel bi dafa nekk di tey versus nga am HIV. So you have to get used to some of the side effect profile. But yeah, amut garab bo amut side effect profile. It's gotten cleaner because bu njëkk bi moo tax ñu ko daan ooyee the cocktail. HIV treatment cocktail lañ ko daan ooyee. Because daf daan bari garab ba nga xam ne and maa ngi ko ñëw laa si slide bi in terms of progression in HIV. Right? So gisee, look at this. Evolution of HIV treatment. In 1987, that was the first antiretroviral drug that AZT, boom gene, right? Then mu nekk di transition to different types. He just names it, right? Nga aga to 2012, which was groundbreaking, when now single tablet regimens came into. Te léegi, injectable amna, where it's monthly and bi-monthly injections. So li ku suñ herbalist yi maa moom dañ dee lii nii ñëwagul Gambie. Right? Afa seer. Ñun ñu ngi ñaanantu pour garab for now,
We are
right?
still dependent.
Waaye mu ngi laa wax science bi naka la gaawee, right? 1985 ba 2001 dem nga ba ku daan jël 30 pills a day to 1 pill a day. Moo tax science HIV fuñ aga kenn waru koo xeeb in terms of just it's easier to treat than diabetes. Te naa ko explain because lu ma bëggoon a endee mooy we're going to do a test, just demonstration, because I do want to demonstrate the right way to wear a condom from a protection standpoint. Last time you ngi ko doon wax. So Omar la nga daaji nga sol. Te lu ma use moom lii ñu ngi doon wax bu njëkk bi. The average penis size in the world is about 5 inches. So mbiri 9 inches nañ ko bàyyi. It's not realistic. Amut. Te lii the girth rëyaay bi góor yi bari soxla loo lii. But we're going to use it to demonstrate that yes, condom size B is just a standard condom size, but we're going to do a test. Yow da nga sol.
waaye sol
Déedéet Omar da ngay solal.
donc mu ne ma sol damay sol
Da ngay solal.
damay sol ñëwal naa sol
ñun kay yàlla tere ñu gis foo koy sol.
So dama bëgg nga demonstrate from the opening
Yo, Omar.
to the ceiling.
ok
Waaw.
Omar waruta mun a
Acha.
sol. Omar waruta mun a
gars yi team pap ñu ko daaji nii
Omar waruta mun a sol.
Rule number one.
rule number
Rule number one. Condom bi bu ko dee def sa wallet bi.
thank you waxalal gars yi
That's condom bi bu ko dee def sa wallet bi soo ko def sa poche bi def ko in your front pocket or foo xam ne bari with friction because soo ko defee sa wallet bi sa gannaaw yaa ngi say talk all the time yaa ngi denature quality bi that's rule number 1 te su nekkee you have a sexual partner leave some at the house of whoever you typically go to because oftentimes you don't have it so Salbi step number 1
You also look at
in addition to that dog di wax gaay rek jigéen ñi da leen di bàyyi xel soo leen demee
inspection
bala ngeen waaw gaay yi sometimes dañ ko dee bëna ngeen bàyyi di xel su fekkee ne
Kuy gaay?
condom bi dafa loose
kuy gaay
gaay it could be both parties
lu tax ñu ko dee bona lu am solo la
waaw lu tax ñu ko dee bëna ngir bokkal ak lor rek
ba pare stealthing tamit who knows what stealthing is
tojal yax bi ipa bi
musu leen dégg stealthing you guys don't know the concept of stealthing
No.
nga dem ba d'accord ne da ngeen di sol condom in the middle of the act góor bi génne ko
mu withdraw like mu génne
mu
condom
génne condom bi rek continuer
I mean, if women do that, not even men. They will do
déedéet waxuma la déedéet man xam nga
yow dog yow dee bëgg a wax ak jigéen waaye jigéen ñi dog
but again,
déedéet waaye jigéen toogu fii duñ mun a waxal jigéen
but they do it. We know.
waaw yeah loolu it do
but then again su nekkutee that way around most times like góor bi daf lay def am sexual intercourse ba xam ne condom bi toj na while the lady do not know
of course
continue
That is one. Yes, that is another problem.
Because-
Why touch mom fu amee rek moom mooy salut ko bu baax.
waaw that depends loolu laa bëggoon that depends on how you wore the condom
So-
amera fana muso sa bondino wa rake o
why did it stealthing comes from the fact ne góor bi right similar condom bi te jigéen bi yëgut ne similar condom bi it could be a change in sensation whatever it is why stealthing the reason why they call it stealthing mooy consent bi was based on the góor bi man dama sol condom nga dem duga for whatever reason nga simi ko ba pare continuer te jigéen bi xamut ne yow simi nga ko loolu laa miin te loolu daf dee am but nañ door si demonstration bi
ngeen xool suñ ko daajee rek na jël benn na su ko amul nga cancel
so quality bi make sure ne it's intact expiry date
bi nga check But does it matter
yes
does.
it does
Huh?
it does
It does, right?
because Lee expires February 2029
29 yeah.
right okay nga ubbi
not ibi am na two sides because of man nu ma ko nekk di gisee side bi moo gën a neex ibi fu am zigzag bi
waaw
so you can just tie it very nice
Omar.
bismillah
Bul bismillah.
lu tax
su nekkee yaa ngi njaalo kañ bul wax bismillah di njaalo
so
ma téel li bu baax nag
nii la mel so yéen a ngi gis tip bi nii right here right so nga téye keroog dog démonstré na nii ngay téye tip bi suma gars yi bàyyi faal
naka nga xamee ban boor ngaa téye
so okay donc man yaa ngi ma jox say jafe-jafe nag man li to be honest moom mosuma koo use you know but based on nu mel nii nga koo use
lu tax
sayr boobu
non gàppal non xoolal suma gars yi def leen
So ma laaj la dara
ñëwal
su nekkee lampa taalul
waaw
yow bu sudee booy def ni naka nga
non
ko def?
gars yi kay fii la ñëw téye rek pousse
Yow mën a puus bu baax.
foofu non lu mooy wax mooy
Waaw.
léegi-léegi ni si dañ dee roll in the opposite direction
I'm telling you
te xam nga condom soo xasee ba roll in the wrong way you better start over
I agree
doo ko mën a ñuuxaat du dem
True again. Put it.
so gars yi gis nga soo leen ko ibee nii lam dem mel basically right nii so da nga koo turn upside down gis nga
Why?
nii nga turn ko pour nga mun koo roll because of nii la soo leen
okay
gis
so bala ngaa door nañ wax ne okay first of all wash your hands ñu ngi ko doon wax the last episode keep your nails clean góor da ngaa set
thank you
ndox ak saabu because lu tax ma wax la loolu soo amutee yaa ngi am all these bacteria nga ñëw simi condom di sol yaa ngi introduce ale gan
yeah
bu si warita bokka
dëgg
but continue
sëy moom léegi dafa jafe bàyyi leen seen xel nag so nga téye ko nii roll naa ko nga téye di tëb comme dog nu mu ko waxee so léegi let's assume
noo ko téye
tëb bi nga téye si kaw nii
sa kepp bi dafa ndaw
dafa ndaw right
waaw man nu ma leen wax mais keppee ko nii
dompat olof yi dompat
right
lañ ko def
nii
kon nii
right
dompaat right
da ngaa create space nga keppa ko
yeah
nii
yeah so
Right?
dompaat nañ ko
te léegi-léegi lu ma dee wax mooy sa tom bi right nga war a jiital su ko defee nga mun a am fooy keppa
lii rek wane na la
parce que gis nga loo ko keppee nii right yaa ngi génnee air because bëgguloo condom bi mu am air pocket so danga koo ñoppati nii dem dan
Ba pare balaa nga egg foofu sax cucu bi dafa war a taxaw.
of course
non su taxawut kee dog
dafa war a leer dafa war a leer
yeah
right
yeah
so soo ñoppatee ba pare dama day wane condom doo ko sol ak benn loxo.
non.
jigéen ñi ku su nekkee dafa sol benn loxo mu ngi téye phone bi solul condom bu baax.
cancel ko.
right so léegi. acca aywa.
acca nga waaw mbir mi taxaw ni nataal lampe bi su ko sol tamit am na solo.
yes yundul de.
let's offee nag.
non bu mu ko na ut toj laay na leer daal.
ok
so nga.
with the left hand.
with the left hand.
so léegi su la laajee yaa ngi ok.
mu ne.
yaa ngi ok.
dama ko xaaral rek. dama war a bàyyi si kaw jamono yëmbal.
yaa ko dugal na mu nga bàyyi si kaw.
waaw léegi xoolal.
su nekkee dugal na ba pare.
waaw nga bàyyi si kaw.
déedéet waaye bul jeopardize sa space bi de.
mu ne la baby yaa ngi yaaga gaawal.
waaw lu tax oyiloo ko rek mu dimbale la.
non boobu dafa naa seeg naa ko dafa am sax. gaawal tuuti waaye ak yow. donc moom na xoolal rek nga róol nag.
róol bi moom dina yomb waaw butéel bi la moo tax butéel bi ñu demee na xar na di problème.
so exactly.
so lii rek wane.
mu laa wane.
yow yee.
problème la.
donc pour Omar leena la musut ko use wala mi
non yàlla xam na ne musuma ko use.
performance anxiety.
non bu ma dugg yàlla xam na ne musuma ko use. it's not a lie musuma ko use. I'm telling you.
musuloo ko use.
musuma ko use. non bi dafa dëgër de.
non butéel moo baaxul.
waaw
non butéel bi xam nga butéel bi lu tax ma like ko. nekkul ñëpp a am erection bu dëgër.
leer na.
it's not a firm erection.
ba pare we have different sizes.
Okay.
So condoms tamit dafa am different sizes.
Okay.
So su nekkee maybe you are like 5 inches ba pare nga dem sol condom bi nga xam ne maybe it's like extra large. like du dox.
so bi ñaata size.
This size fit for all.
Okay. Medium size for all.
Yes.
Okay.
waaw mu ngi laa wane lii su nekkoon bidon bi amutoon. waaye just to demonstrate ne.
Yeah.
5 inches.
the average.
So
no the
length.
size.
5 inches width.
ban tubéy nga ko dugal.
boobu mu ngi nii.
You are talking about size. It has to do with the weight. It doesn't have to do with the length.
length waaye measurements.
If you are saying extra large, small, usually consider the weight too.
yeah waaye du ma la explain leen ok xool leen.
leer na
gis ngeen butéel bi.
waaw.
right.
waaw.
doomi aadama butéel bi moo ko ëppa. right. déedéet because butéel bi.
butéel bi la
no waaye loo wax dëgg la de because yaa ngi explain that awkward silence.
yeah.
gap boo xam ne jigéen baa ngi xaar pour yow nga sol condom yaa ngi bañ moment bi mu raw la moo tax góor yi bari dindee sol condom because it requires a very awkward moment boo xam ne soo nekkee góor yaa ngi am performance anxiety comme kii lu mu def 1 2 rek first one bi toj na te léegi nga xam ne benn rek a des sa poche bi boobu naka la wala su nekkoon benn condom rek nga ñëwee léegi lu mooy def
ñu mën ko dañ ko mën
déedéet non waaye dëgg la de right because su nekkee kii benn condom rek la amoon nag muy ko sol mu tëj then what da nga am mission abort
no ban cancel
du cancel.
no but I'm telling you these are some of the cases yoo xam ne kii mënoon naa nekk the last condom am mu tëj fekk ku mooy ñëw tëral si is HIV positive the universe works that way di nga benn yoon la rek man nag duma aaga fii nag duma continuer right te su nekkee moom insisted ne ok nañ continuer rek di dem because góor yi we don't make good judgments when we have an erection just in general we make the worst mistakes with an erection
foog loo ne dokkoon jigéen ñi ñooñu ko war a solal
it's possible
so it's important nga xam naka la ko gaa di solee.
they should know how to wear it if anything it's actually healthy because yow soo ko sol moom ngi toog di la xool xaw ma boobu de right but all I'm telling you is butéel bi is longer and bigger than the average Gambian man just in general right average human being pinching the tip yaa ngi gis si tip bi fu mu nekk nii mu ngi still am space so lii mu ngi laa wane is also a repository yaa ngi may space boo xam ne soo éjaculate sperm bi na ko mën a téye waaye once again su nekkee door nga di am sex mu touch stealthing moo nekk nii nga def nii moom gisut luy happen nga def nii léegi-léegi mun nga faa bàyyi band bi sax si base bi waaye yow fu mu nekk nii door nga di am unprotected sex te jigéen bi xamut ne condom bi touch na o yaa ngi doon wax withdrawal method bi yow nga nekk di foga nga foog ne condom bi is intact and then you climax inside of the woman soo ko génnee nga realize ne pax mu ngi fa woon.
léegi dog ma laajte la.
No, at that point, what do you do?
boobu kay da ngaa bàyyi mu jàll rek. non dog. dog léegi
lan moo la war si at that time. I'm telling you this because it happens every time. ma wax ma mos jigéen man dama la ne responsibility sol condom si góor bi la nekkul pour jigéen wax la nga sol condom yow yaa war a ñëw fankantal sa boppa man lu may wax góor yi ne don't trust a woman who doesn't want you to wear a condom because there's nothing special about you. xam nga góor yi ñu léegi-léegi suñ ego daf ñu dee nax yow sa xel warut a dal jigéen boo xam ne santam bi sa xamuloo ko mu bëgg laa bàyyi nga dugga te soloo condom da nga war a xalaat ñaata góor la bàyyi ñu romba du yow so lañ bàyyi di jox responsible dafa mel ni next day pill bi lu ma laa explain nii yow su nekkee yaa doon sol condom bi toj or dang they always depend on the withdrawal method te léegi-léegi ni si suñ solee condom duñ withdraw dañoo ejaculate ba pare yaakaar ne condom bi jàpp na ko soo ko génnee fekk condom bi tojoon na yow yaa war a jóg dem pharmacie si saa si di nga war ne condom bi dafa toj te am na spam bu dugga si yow what's the game plan nat nga génnee rek moom mu foog ne dara jotutoon then nga realize ne ok wax bi dem na ñëw na te last time ñu ngi doon wax the power dynamic su nekkee ne yow yaa ngi 40 moom mu ngi 20 ab day am si dëkk bi du la ñemee wax ne man dafa mel ni condom bi dafa tojoon de nga ne ko hey bu ma yeb ma soloon condom right so you have to be mindful but I'm glad you demonstrated that. I'm glad ne boo ko doon sol dafa xar it's the reality it happens all the time so that means that you should have multiple condoms always available so if you have a regular sexual partner just keep condoms next to the closest place that you're likely to have sex it could be in the drawer anywhere nga xam ne sooy ñëw sax or sooy dem once again for people that are not married xam nga ne loolu nekkul the issue if that is the conversation if it's not comme nu mu ko defee still practice safer sex by testing together using PrEP and things of that nature right but very important te Musa bu ñu yokk ndox si lii
so kan nga test léegi
ku pare rek nu ñëw we have volunteers
so doc ma léegi lu ma bëgg a laajte si test si
holding the tip, but no one explained why you should leave like space.
So holding the tip is to give room for friction, right? Because friction, bokk na si lu lay mën a touch condom bi bis nga soo ko solee ba amut space sooy penetrate dafa mel ni yaa ngi hita mbuus boo xam ne amut space it's more likely pull friction bi te some people the sex is not always just like a regular human being ñu bari jiko mbaam lañ dee bëgg a def no but it's true
But some people like rough sex, no?
Yeah, but it's more likely for the condom to break. More time, am na ñoo xam ne then they lose actually a lot more space ba nga xam ne condom bi daf dee langa during sex. Lii lu amee ñu bari is too little of space. ñu bari then they buy so much more space ba nga xam ne the tip of the condom is falling down. And then you begin. So ko defee you leave room for it.
So the loop is for friction, not sperm.
Friction and sperm. Right? Friction, sperm, but also once again, yow sa pre-combi is lubricant boo xam ne fu mu nekk nii amul access to the female. Because you don't want the last time the male, when you engage in sex, your penis discharges pre-cum as lubricant. So in this case now, the pre-cum is inside the condom, which will increase the use of it. Why the space is designed for friction reduction, but also as a repository pulmonatie condom bi. Why man luma de wax moy best practice still pull out even wearing a condom.
Time to time nga check.
Right? And then you do quality control in the middle of sex.
Takaleen jabar rek moo gën a yomb.
Why xam nga ñu yow def woon loolu rek.
But then xam nga lu xew tamit it's not about takaleen jabar
loolu
like you can get married and then like you are a virgin maybe your wife's a virgin and then like that was your wife's first encounter and then your wife turns out to be positive
and how many people bala wanna say sir
understand so there are certain people like this I know earlier not anyone that has HIV has it through sex
no
understand because some people, they just had sex once, they get infected.
Yep.
With that one person that they had sex with. In Gambia, most people are getting married while they do not go for testing.
A lot.
Before the person that I'm dating with, both of us have passed. Well, I'm not past, I'm not small past. This person doesn't know.
Yep.
What she was doing, I do not know. So we are just coming as one. So if we are here as one, it's important that before we engage into anything, either if we are not practicing safer, let's go for testing.
Yes.
Like he mentioned earlier, people are engaged into rough sex. Yeah, people have different ways of getting satisfied. But then if it comes down to now, it's your responsibility to protect yourself. It's your responsibility.
Yep.
If you know that you are into rough sex and then maybe the condoms, you'll be experiencing a lot of condom breaks or condom bursts, go in for PrEP and protect yourself.
Yep.
You are good to go.
So testing is very easy. So self-test kit B, just to remind, what is even the kit B? Right? If you are on HIV treatments, do not use this test. Time nga test kit si, then lay every single instruction with pictures. Yo sisa bopa munga wait to sa nek nga test sa bopa. So then lay everything that you need. Loy bone sa lohabi, the lancet, right? Then lay loy tibe sample bi.
Abdullah.
Then lay
Abdullah.
ana buffer bi.
It is there. Buffer bang si beer box.
Yeah, ma ko tege one board.
No, si beer.
Lafarot. Yeah. Right? So mu ngi laa jox buffer bi. So te ñu bari ñoo xam ne dañ daan use COVID test kits. It's very similar to it. Right? Very simple. Plus boy def sa deret bi. Right? Te daf la dee jox picture bi. 2 drops of sa deret bi. Nga plaster sa deret bi, obviously. And then nga jël sa deret bi, def drops si fii, and then nga def fa buffer bi, and then you wait 15 minutes. It's that simple.
So, lu mo isi ñaari line ah.
Ñaari line mooy affaire bi piste bi baaxee.
Xam nga dam lay wax lii most of the time, nga am sex with someone that knows their HIV status and they are undetectable and you practice safer sex, it's way more gain that you having sex with someone that doesn't even know their HIV status. Because this person that you're having sex with open up to you that, okay, I'm positive, I'm undetectable, and we can practice safer sex.
Yep.
But most of us, we will just, as far as that we're horny, we just enter it.
Yep.
Without protecting ourselves.
Allowing our erections to think for us.
Yes.
So quick them. Mr. Virgin.
Waaye na leer nag saa emphasize na ne man suma baaba bi dafa ma dee always di gaañ pour mu leer non waaye dafa war a leer
No, I guess yoo xam nga yow lay def nii.
dafa war a leer
yaa ngi ko defal askani Gambia bi yëpp.
I do not know.
mu ne
Donc sa statement am bi fallback plan la.
non doc suma baaba bi dafa ma dee gaañ te dama dee always di
Dama taxaw
am is slight injury si suma laal
Déedéet fu mu toog yow noonu sax mun naa yottali loxoom bi rek.
Yeah.
oh really
Yeah. Right?
And doctor,
So ba pare.
pour ka ko indi mol la.
Yes.
Te solo me alon ko asone ata bakele komi ba fuka nyameng. Ifo ngo se ni isa karanno fon ifo ngo kayto bala ya lon ko asone ata le kake. Andu jamal bije melke silandi pulon soro nyinti. Ibe mari bulo sola nyame kaje ko pengundi ngolong me alon ko ese bulo sono e yelo domanding ta yakije. Amanke kuti me alon ko nyanta silala. Inyanta silala men la wolom ni me fang test imalo membela then aita fa ay wajabi ay na kolya ku dol sabu la wala na ku mata bakele pour mo le testing ke alon ko ke o sone atale andu amanke ka pengu baleta pour ke so yaje ko ma ba ke kan nyamen abina soro ke la yaje la mo dimi bake ay so then ay yelo nyinta
You can use this. You can use the
na yelo nyinta ay ak kaseto nyin kono
easier for you.
na ak kaseto nyin kono fa parita then ay jila ma do ki je na ak je
ko yërem boy ci ko.
No, this is fine. No, this is fine.
ñu ne mun nga koo am si kotukaay
Si kotukaay.
Komi ba foka nyama fana jamal bije isa soto no nyamen jama ya mire isa soto nyame wolem komi ni kewani muso kafuta damma jamal bije fana isa soto no ni mo ye mo li wala fengoy mo barama me alon ko ala bala le sa nyim bala le yelo fintita wo yele kilingo wo ye modo ma ay fendo ma men boko lansetol nyongol babin masingol then ni way ta ko den kay modo barama yelo ñun dunta ko no momi alon ko ama soto num amari sina ka ñi sa soto no wala na ko maytale amanke dorong mo moye ñi sa soto aya soto feale kam makato ñimbo mo jamal ko ko no ngal mera mo moye ñi sa soto aya soto feale kam
isa keno vagin fana ya soto
isa keno vagin oti nene man kafu ene nene kew wala nene muso man kafu ya soto
ya la vagin no wanke o tuoti sanga mo ko hi fonante bo don fi Omar fi
deep kissing abbe saha abbe fana sa kesele
anu ngamuta ko ite ka deep kissing okay
yeah but pare luma don explain just pull in luma def more it's very easy testing be obviously you're going to wait 15 minutes so test bange go on
15 minutes right
yeah 15 minutes right it'll probably feel like 15 hours or 15 days right but mungla one it's very simple right deret bu ndaw la pengola comme ñu dé jëf blood sugar test right so ko jëlé rek nga drop ko den li nga def fa lini bi the moment you drop it nga tek ko on a flat surface and you allow it to go so li mung la wane even yo once again if you were getting ready to engage with a person ko xamne you want to know your status once again it's key to remember that they could be HIV positive and test negative because if they're on medications wa su nekké yan ñaar yépp amu len sen status and these are some of the things where now I'm gonna first date you know what made consent gis nga jigen so demé be ko xamne neku sa jabar you got to have a conversation about two things are we going to test what's our pregnancy protection plan lolu dafa ba pour nga xam ko
how are we going
right so while test bangé dem
dimbalé len ko ci musuwar
yeen ñep ñu am fi you guys could test it once again testing is available I want to run through something while we wait for his test a lot of the things we've been talking about it in terms of naka lañ ñu ko jàngalé right so we've talked about a lot of these things prevention method I was talking about the Gambia HIV situation. There should be PrEP, not PEP, safe medical practices, education and campaign awareness. Program B, Sila Boka. Condom use, we've actually just talked about condom use, regular testing. HIV treatments, obviously testing, counseling. Keba bugo nanga wahak niti in terms of how difficult is that first conversation? The first time nitki mo am positive results. Your whole life could flash in front of you because yaa ngi remember ne nii la ñu doon brandé HIV biir Africa. HIV da ngaa dee. Théâtre yi Sénégal sida. Ba nga xam ne nit yi yëpp dañ ko foogoon ne it's a death sentence, right? Waaye soo ñëwee, we're talking about this, right? Look at we talk undetectable, untransmittable, right? Close to zero transmission risk when you are undetectable. 95% treatment success rate when it comes to HIV when you have access to medications. And on average, between 6 to 12 months of continuous gut-up, you should be undetectable. And the life expectancy normal. How many Magic Johnson is still HIV positive?
Yeah, I know someone living with HIV for 25 years.
25 years. Man, I had an 80-year-old woman who got it through blood transfusion in America, who was on antiretroviral. It actually does not affect your daily life.
HIV actually itself do not kill.
No. Yeah. Right?
It doesn't kill.
Yeah, I want us to look at this. I'm going to say, if you told me to choose diabetes type 2 and HIV, I'm taking HIV.
Yeah.
I wanted to create this file to show people the difference between the diseases, right? HIV treatment, diabetes management. Single pill a day. Legi technology are going to be monthly injection, right? Diabetes, multiple medications often needed. Minimal side effects, because with technology, the more the drugs are, the less side effects. Bunjaka bi cocktail be used to be bad. Then I'm side effects you buddy. Xam nga naka lañ difficulté pour manage diabetes, especially ko xam ne am na insulin mu ngi soxla garab. Your whole life has to change. Every single second of the day, sa blood sugar bi mu ngi change. Nga naan coffee, dem na si kaw. Nga lekka mburu, dem na si kaw. Mu beccee ko waat. So the entire 24 hours of the day, up and down, up and down. No dietary restrictions with HIV, right? Completely normal, most of the times. Hopefully this should be back. Okay, completely normal. Quarterly monitoring. Checks are viral loads. Once again, Gambia is free. Monitoring day to day.
Right.
Every subaranga checks our blood sugar. Yep. multiple targets. Yaa ngi irrité A1C bi, yaa ngi irrité sa blood pressure bi, yaa ngi irrité cholesterol bi. Single target viral load. Single condition, right? And clear success metric, undetectable. This is a progressive condition in terms of diabetes management, right? Get them to the next level, right?
Donc maa ngi dese 2 minutes.
Yaa ngi baax. So talk about the daily management. On average, it takes 2 minutes a day to manage somebody with HIV. It takes about 60 to 90 minutes a day to manage somebody who has diabetes. Take every pill once a morning, continue normal activities, no evening requirements, lab work monitoring every 3 to 6 months for viral load. Diabetes. Gambia nga xam ne ñun xam nañ prevalence of diabetes biir dëkk bi fii. Monitoring every single day. So soxla insulin, yaa ngi calculate some meals, yaa ngi seet ndax mbaalo bi doy na, mbuuru bi doy na, yaa ngi war a exercise, si ngoon si yaa ngi check, su guddi yaa ngi check trends. Continuously yaa ngi check in terms of diabetes monitoring. Healthcare impact. On average, complicated case of diabetes, about $13,000 a year. Ñaata Gambians ñoo mën a afford loolu. HIV, what's the cost of care in Gambia?
0.
It's free of charge.
Free of charge, right? So suñ la bëggoon a laaj HIV positive or diabetes?
No, man yàgg naa di ko wax moom, I'm going for HIV.
No, but it's important.
Yeah.
Because xam nga fu ñu ko dooree ne yaa ngi paree dee si. Waaye diabetes moo gën a nekk di rey nit yi. Lii ñu bari mënuñ ko.
Many no ko waxee before moo tax léegi ba tey nit daan ragal about HIV.
Yeah.
Because society feel like in advanced countries, like the person that I said I know him, like he's taking medication for 25 years now. In the UK, you can take the injection twice in a year.
Yeah.
So every 6 months.
Okay.
So it's up to you and your preference. Like, are you taking the daily pills while you're going for the injections? You just get injected once and then you're done. But next appointment when you are, instead of taking medications every day. So apparently, people that are living with HIV, question you body there like them one or.
Yep.
So with these medications, you just choose a time that is suitable for you. Munga kwana on an empty stomach, you can eat it when you have eaten. Like you can drink it when you have fully eaten. So it doesn't affect your day-to-day activities. No. You can live a healthy life as far as you are taking your medications and be on the safer side.
Yep.
Yes. So I'm jaru ragal wala turbare rek. Turbare rek.
The moment we've been waiting for. Now we know the HIV status of one person on this.
So fa laa tollu dog.
Aga nañ.
Ñëwal.
Right? So, test kit bi, comme ñu daan def self-test COVID. One line,
Negative.
the test is negative. Once again, if Omar was on treatment, he will get a negative test.
Thank you.
More than the test, the premise is somebody who is not on treatment, right? If it's 2 lines, waxtaan war naa door fu mu nekk nii. Am nga jabar bu ees. Boo xam ne da ngaa dundaa moom, right? And then control line bi, su nekkee ne line bi nekkul si C, then test bi dafa default. So lii ku jàngut sax in terms of somebody who am ne amut literacy. Mun ngaa use test kits bi. Within 15 minutes, you know where your status. So gisee line bi, Omar has only 1 line on C. And Dr. Pa.
Yes.
Musa
Right?
kay test.
So
Ibrahima kay
maybe
test.
this is one test, and maybe virginity be.
It's true, man. Thank you.
Right?
Thank you.
But it's very simple, right? But regardless, and you're right, man, at least twice a year I get tested.
Okay.
At least twice a year. I'm always a little bit nervous every single time.
No,
Because
no,
do they ham,
Yes.
right? Why you fum nekani ham ngane fum nekani yo mun nga natali so def ko sa social media status.
No. But then this after 15 minutes or 20 minutes, it's no longer valid.
The test.
Yeah.
I think that
What
It's
one?
no longer valid. Yes.
that is like within 15 minutes.
So let me read it. Let me. No,
No,
can I
jela
take a picture? Bilal? Thank you so very much, man.
so nga verify ko, right?
Nga mena doctor come here for
def sa loxo bi sa loxo ba am place tamit. Nga xam ne def nga piste
So I'm going to normalize that. These are some of the pictures that instead of asking them for nudes, ask them for this picture.
Yeah.
Or maybe they can actually buy this, put it in your room. Like if a girl
Perhaps I need to take a picture as well.
Yeah, honestly.
start testing that.
No, but we don't ask for the right things. No, but do it together.
Yeah, we do it.
Because it increases trust.
How much is this?
It's not expensive. And most places you
Go
could
together
get
with your partner and get
yeah,
tested.
you could get tested together with your partner. But anyways, thank you for people that volunteer. We have some few test kits new for people that want to get tested.
Oh, yeah, you told me earlier.
But key takeaways.
I'll bring it to Innovax tomorrow.
And once again,
no, you can give one to Fatima. She asked me
yes,
for one when I
please.
just came.
Yes. So it's just really important, guys, especially.
And there's another one. Sorry.
ñoo xam ne young people la lii message bi pour yéen la like bu njëkk bi dañ daa wax ne xaw ma woon.
Yeah.
léegi kenn mënut a wax ne xamuloo. te léegi mënuloo wax ne tam mënuma see jot. right but just pour mën a door di wrap up key takeaways yi luñ bëggoon a waxtaan. obviously Gambia man du ma dee bëgg a wax sax ñu ne we maintain a low prevalence dëgg la when it comes to the general population less than 2%. Why believe we have communities where it's 3 out of 10 Gambians, right? Yep. And also the HIV one is on the rise around. So definitely
Hepatitis now.
like hepatitis tamit,
Exactly.
which family cousins led.
So which is more deadly?
So according to my research, hepatitis.
Yeah.
Hepatitis B.
It's hepatitis B.
Okay.
So according to Gambia, they did a study, and then in every 10%, there's one positive for hepatitis.
But mun naa wax dara rek ah.
Okay.
Góor lu gën a salte in life mooy nga sànni use condom si tali bi.
billahi wallahi.
man mënuma understand doomi aadama ban façon doomi aadama la maa ngi far lii loolu la suma xel bi dem parce que léegi-léegi am na yenn ruxuro koñ.
Moussa noonu la defoon mu for ko.
te am nga Moussa boobu dañ laa bàyyi mu romba parce que bu mu ne dafa for use condom maa ngi xalaat déedéet.
No, this happens. Da ngay gis nga use ko pare sànni ko anyway.
dañ ko di jël rek sànni ko.
problème mooy ne because most of them are hiding.
Yeah.
dañ ko raab da ko suppose génn moom sànni ko si mbalit bi.
flush ko.
Yeah.
flush ko.
mus naa dégg nu mu tudd Gambia College mus nañ génnee condom si body gaa seen manhole bi de daf leen block bagaas yi.
So what's the preferred method pour sànni ko da nga ko war a flush.
In a nice part.
You know what happened is this country we do not have like bins to throw plastics or anything.
Yeah.
So these are the problems. But there are no like there are limited bins around.
no waaye nga jël muus rek.
Nga taxaw ko sànni ko.
waaw first of all bu ko sànni si mbéera bi.
nga gis fu ko xale di foree di ko fuuf di balu.
Moussa mu ngi doon wane. te xalaat leen loolu xam nga lu mu nekk di woon. mag bu toll ni yow. nga def loo war a def. nga semi use condom. sànni ko boo xam ne all kind of body fluids God forbid. xale bu ndaw jël ko for ko doo di def lii. def fa làmmiñam bi yëpp. that day happen. man góor yi xaw ma lu ñu daal jaag wan dëgg neex yàlla.
Yeah, but again, when we talk about the STIs, one of the things that we talk about also is the hygiene after sex.
Yeah.
You know, hygiene after sex. Because again, it's important that we talk about how to put on condoms and we laughed about it.
Yeah.
But how do you remove the
How do you
condom?
remove it?
And how do you dispose it after? Those are things that we need to talk about as well.
Who knows how to remove it?
Acha, ñëw leen.
It's not invasive.
Can you volunteer?
Huh?
Waaji, can you
Removing
volunteer?
it
Dom day.
just to be far away from the young
You cannot remove it over her.
Yeah, you need to up,
Right?
up and go away.
You pull it down ba nga xam ne mun ngaa still keppa then nga roll ko out.
And then wash your hands after that.
Right? And then you go, ideally, you dispose of it, taka ko, or do something. Most people say flush it. I am used to flushing it. Did it. They génne ko in a way boo xam ne liquid bi
Do spill.
du spill. waaye man lu ma daan wax mooy lu daan dal xel mooy nga flush out ko sa boppa. bu ko bàyyi foofu ba pare raxas saabu nga raxas sa boppa. Right? mun ngaa dem to the extent su la neexee hand sanitizers da nga jël nga fogal ko fa. Whatever you need to do, you do it. Just make sure you clean yourself properly as well too. But also, don't leave this at somebody's home. The amount of problems lii indil nit.
Ning keba ñini kardanta rek tariyari mo kadu ngalo nen kanyin kuma jamal moyle kafo keo maniyo men kabo keo bala e ko ni nyada mu wala ke nyada fresh ndile ngalo ne kanyin moyle jamal be dok wala jara kende abundal to ando ngalo ne ni maniyo mu silol di me alon ko sa sa tetar no kono ngalon ne ko niya min tumando askeno ase ite sasa ni soto nola bari silang ni nyada baramata ngalo ne jamal bije nyada melka keje nyada ka pimples te soto ando pimples e ka detele aka jamal bije ka ke barama nolti ite nyinta e ko because lafto pimples le boy nyada bala maniyo nyinta ya mu nyada bala
Some people do that?
Yes.
ite sasa soto no bala
Sperm.
Yes, spam. Yep.
Cool.
Guy.
People are using it.
Well, who is that proven though? How could sperm be good for skincare?
Guy, no.
It has the zinc, it has the all of those things.
Which generation is this? Gen Z?
Doctor,
Some people say that if you drink it, it's a protein, like it can give
Exactly.
you nice body and everything.
Doctor, misconceptions
These
are
are things
spread
that are
faster
spread
than
outside.
proven theories.
There's a time I have engagement with a room service guy that's working with one of the hotels in this country. There's someone that comes and buys sperm from them.
Wait, what?
That buys sperms from.
And do it what?
I don't know what the person does it. But the fucking Genesis guy, the friend just okay, the man masturbate or something.
Wow.
then you sperm. Like that was the first time hearing something like that in this country.
No, why in the USA there's sperm donor
Yes,
centers.
so,
like you could donate sperm.
Why you doko dem janal BNB jar ko tuti joko ko boy. BNB mail you know the halen niro expand.
Condensed milk.
Condensed milk you know.
See, the truth is, Africa is a virgin for harvesting.
Yes.
And there are people who have sperm donors banks
We do the surrogacy and everything.
and a lot of things that, this is a good business, by the way.
Exactly.
And if you're here, the pass is a problem tomorrow, somebody come offer you and saying, you have a few mils of sperm, you can give it away
This
freely.
is what I was
But
saying.
how much for them?
There are also male sex workers too.
Yeah.
Because munam te yang strong wala you work back to the family. Nga dem si bi ta say bena mayor wala bena pa minal lila money spam. Munam I have a company or something that I want to run. Yo na nga halat munam proposal like bena 5k wala bena $1,000. Nga halat nga wala you work back to the family. So these are the things that put most people at risk to do certain things.
But anyways,
Keba, saying woko ending na mo se sasa ni soro no woto bang wala
let them keep sperm away from your face.
No, but some people prefer cum shots. So yeah, these are the beliefs
It's
that
a
people
lie.
have.
There's no scientific
Yes.
evidence that says that sperm does something. Doesn't have topical use.
These are the beliefs that people
saying
have.
foi se sasa soro no je nyin sasa ni wala HIV din ko sasa soro no je
Kana kije in the first place.
Like
Gentlemen.
what I said, like if you are swallowing it and then there are sores in your mouth, you are at risk of HIV positive.
What?
People are doing it. So
anyways.
there's not like, hey,
Halfway forward, guys. Man hama hala ilan len neka di dunde fum neka ni. But either way, wahtan bi amna sala, right?
Yeah.
One of the things I wanted to come from Dore, bu Keba donyo, and I'm grateful that Keba has been here. Keba is a social worker for Innovarex. He's doing work with HIV. He's done so much work in the te lum len wax yep lu nekk di am la si biir dëkk bi. Waaye mu ngi leen wax ne there's two types of people and all of us fall in one category, the infected and the affected. Every single Gambian amul 6 degrees of separation de. Ku nekk sa circle you're affected by HIV. Sa waaji mu ngi feeca because mu ngi am positive gën a good. Right? But some of the things yoo xam ne dañ ko war a fulal mooy equity. Equity moo mean ne dafa war a am in terms of access bi. It's very, very common because I'm in the regions, I had a stat in terms of prevalence. I'm the problem. URR has the highest prevalence rate. Body basse. Yeah.
and I think with the recent data is West Coast.
West Coast now. Yeah. So West Coast is Greater Banjul area. Banjul?
Check, I didn't go out through the data a lot, but then like last year, West Coast region has the highest.
Highest region.
Yeah.
So it's prevalent. 60% of Gambia's population, I think, lives in the Western region. But equity meaning like populations, they need to have access to testing, treatment, right? Because ñun ñëpp dañ war a dugal suñ loxo in the 95. Nekkut liggéey healthcare workers yi rek. Integration bi ñu ngi doon wax in terms of stigma bi dafa war a dem. I think there's new ways of delivering services that ñoom Keba fu mu nekk nii they're deploying, which I think is helpful. Community engagement bi ñun ñëpp dañ war a doori destigmatize man episode bi ku ko seetaan next time soo toogee biir nit ñu nekk di wax mbiri HIV loo xam ne xamuñ ko you have a responsibility wax ne lii demeewul foofu right ku nekk daf si war a jóg because ñun ñëpp it's all fun and games until it starts affecting you te waruñoo judge lifestyle in it because nit ku nekk sa bopp rek nga mun a garantie kenn xamul lu nit di def si biir lëndëm dëkk bi moom ñun ñëpp day foog ne dëgg la dëkki jullit la ba ñu ma yooyu yëpp waaye ñun xam nañ ne dara we're not immune to it. Every society has its challenges because HIV bi ñun ñëpp foog ñu dugal su seen loxo. So Keba di la delloo njukkal rek di la wax ne jërëjëf sa liggéey bi you gotta continue doing it because it's important. So obviously in Overex, we believe that access to healthcare is a human right. So we see HIV the same way we see diabetes, the same way we see hypertension, because honestly, in this day, it is easier to treat HIV, somebody who's HIV positive, than it is somebody to treat diabetes or hypertension. 3 out of 10 Gambian adults already has either diabetes or hypertension. So loo xam ne waruñ ko bàyyi gannaaw soo seetaanee episode bi yéen ñu nekk Gambia yéen ñu nekk bitim réew HIV demut fenn mu ngi fi fee step te ñun ñëpp dañ si war a jóg so bàyyi gaay ku nekk saani si kaddu closing remarks mun nañoo bàyyi Keba mu doore si closing remarks bi loo bëgg a wax nit yi
so suma closing remarks yi mooy nekk no one should give you an excuse so my closing remarks will be like, there is no excuse for someone to tell you that I cannot, or I am unable to do HIV testing. Okay. Because in each region, there are hospitals where you can walk in and get tested.
Every region?
In every region in this country. Anywhere that you go to, you can have access to HIV services. All of HIV services, either condom and ARVs. So with PrEP, it is available and you can have it with Innovax. And then there's a HIV helpline 1223 that you can call. One of it is run by me, and then the other is run by with a colleague. But if you call and you don't prefer speaking to me, you can speak with a lady because it's run by 2 people. And then it's time that we now have this conversation with our partners. Go out there, get tested with your partners, making sure that you are practicing safer sex. If you are positive for HIV, take medications, protect yourself and protect your partners. Because you do not know, like, hamulo. So I might get married to your sister, I might get married to your brother or someone. So those that are negative and they know they are they are sexually active, you can walk into Innovax and then get your PrEP, and then self-test kits too, you can have it there. Or as mentioned, you can call the 1223, and then if luckily I pick the call, then I don't mind meeting up with people. And then if you are positive for HIV too, if you contact us and then you are registered with Innovax, you can, or more likely, you can get service at your home. Yeah, out of this stigma, anything, you don't need to go to the hospital or anything. You prefer taking medication with Innovax, then you can get your treatment at your house, at your doorstep, or anywhere that is convenient for you. So yes.
So campaign then you want to do the HIV testing day. Boy, yep, fi amul ragal.
No, I think there's a program for the adolescents. I'm not sure how they're doing that.
That's something we need to reactivate, right? As well too. But
and it's free. The testing of HIV is free of charge. So just walk in anywhere and get tested. Yes.
Amad Jange tey moom.
waaw tey moom gars yi comme soo doon ko waxee rek. waaw nekk jàmbaar rek. waaw.
Jàmbaar nga nag xam nga lu tax ñu ooyee lii sa campagne jàmbaar. What you did was courageous.
Indeed.
Koo xam ne testuloo. nga gis àdduna bi yëpp gis nga def dara loo xam ne. nu mu fa taajoo rek yaa ngi baax. góor dëgg nga nag.
But I was so anxious nag to be honest. maa ngi woon toog si hot seat bi. waaye donc ma laajal question. donc li su tolloon nekk ñaari laaj yi nag. trust me campagne bi dafa tas. campagne bi dafa tas konoon. waaye
ni ko nga nekk suñ Magic Johnson i Gambia.
mu ne lan Magic Johnson. kon donc ma laaj loolu kenn du ma ko nettali nag.
waaye ni ko naa. am naa episode bi la 50 million views di ko am.
moom ragal naa kon episode bi du dem. moo demee 50 million moo demee nag yaa ngi xelal lii jàlla.
man de waxuma la doo am jabar de wax de.
donc kon xoolal dañoo pare fii rek baara maa ngi nii de. maa cross léegi. waaye fu ma xam fu ma yàlla yóbbu baax na waaye di leen gërëm rek di wax ne Keba thank you so much for coming di wax ne si man dog man this is the best so far. Because of dafa nekk loo xam ne comme duñ ko dee waxtaanee si suñ dëkkuwaay yi. te dafa nekk loo xam ne tamit ku ko am rek yow da nga dee feel isolated. society bi dafa la dee beddi teg la beneen côté.
baalal ma sorry. I xam naa tàggatoo naa ba pare. But then there are a lot of support societies in this country for people living with HIV. there are lots of support society. So these support societies are it's just HIV negative, HIV positive people, just HIV positive people that gather together, supporting each other, assisting each other, and they have regular meetings and they are having activities. They are back into the societies, and you do not know. Some of them get married outside, some of them married within themselves, and then they are negative. I have seen with my work. Sorry, I'm not talking about my. I've seen a partner. One of them is positive and the other is negative, and they have children, and all of their children are negative. And I know two partners that they are positive, and all of their children are negative. So, HIV is not something we need to be scared of, not anymore. This is why most people are not willing to come forward to open up about HIV positive. I can remember what AIDS Day that was done in Gambia. They asked one of the support society members, someone to come openly about their HIV still, and they all refused. Wow. Because they were thinking, okay, someone they're in the society, how are people going to see me? And then HIV, the stigma that is attached to HIV is why most people are not willing to open up about their HIV status. And then it's high time that if you know that someone is positive for HIV, we are supporting these people. You cannot have HIV through talking to someone or hugging someone or sleeping on the same bed with someone. We need to make sure that we are supporting these people living with HIV because they need us. These people are working we are sharing the same office spaces with them, the same food, eating the same food, and then we are going to the same restaurants, the same clubs, doing everything together. And then we do not know. Because you cannot look at me and determine if I'm positive or not. The only time that you can know is testing. And then secondly too, sometimes gis nga ñaari botuli baala ma ñaari botuli dan draw mun naa bii dafa xala opalante bii dafa gën a slim so mun naa ñëw rek kenn maybe I might know that this is PrEP and then you might not know, but then kenn mun na laa wane okay, I'm on PrEP. How will you verify that? So you do not know, you say okay, I'm gonna have sex with condoms. But if you are giving a medication, all of these are sealed. Do not use one that is not sealed. With conversation I have with people, they will request I'm on PrEP bottle, empty one. I once asked out of curiosity because I never bothered. So I asked me, I saw this medication. I'm like, why? Because this is PrEP, so I can just simply tell someone I'm on PrEP. So these are things that happen. Then what about help? So if someone comes and be like, I'm negative, I'm on PrEP on something, do not be mindful. Get tested. Be honest. Just protect yourself. Making sure that you are protecting yourself is key and important. Absolutely. Yeah, thank you.
Yeah, am na solo Keba di la jaajëfal rek si contribution boo def ni am na solo trop comme di delluwaat di ñaax askan bi rek comme buñ ko ragal nañ génn ñu dem test so lii dafa nekk loo xamee ne yeneen réew yi ñu ngi ko bëgg a am free
of charge
ñun yàlla jox nañu ko free so let's use that opportunity pour ñu dem seet suñu wér-gu-yaram fu mu toll
every 3 months every 6 months
exactly so te Dr. Badji jox na a very comprehensive distinguish between HIV, hypertension, and then diabetes as well. So, nit ñu bari time bobu nonu solon ko waxe dañu wax ne diabetes mala hypertension mo len ko gënal, you know. So not knowing ne yoyo gëna graw HIV bi ni. Comme di wax gaay rek comme na doc num ko waxe Innovarex ñi ngi joxe yini so
you can get all of the services there.
Exactly. You
just
can
walk
get it.
in
So
or just call the helpline and then
exactly. So fekkene ne góor nga you don't feel like coming during the
you can come on Sunday.
Just come on Sunday whereby male doctors in your nega and then XYZ. So Keba di la ñaax di wax gaay ne xoolal dem leen test.
Why not Chesa mu ngi celebrate.
Mu ngi free. Dem leen test.
Let them get tested.
Little Chesa.
Dem leen test. Gisoo dama test. Chesa ñëwal.
Boy tàccul leen Chesa.
Ikatin sa boss. Chamuloo results yi
results yi
leen test.
Am na léegi dañ ko bàkkoo sax.
So knowing
ili bako la bu Chesa di lo fok Chesa def ni.
So knowing your status is way better than not knowing your status.
Absolutely.
So either getting tested, you are positive or negative, but Hamas status.
Right, more
then you can know what to do. Because when I get a test and I'm negative, then I have to war na moytu.
Yep.
Te suma test mo positive to na xamne wa da wara am jël ci gara but mo gën ki xamne testu defu dara so the person is always at risk.
am na solo te donc bu ko tëj rek di jox ne suma jàmbaar of the week maa ngi ko jox HIV patients yoo xam ne ñi ngi sick treatment
akañ
yoo xam ne ñi ngi jël seen garab yi di leen wax ne man yeneen suma jàmbaar of the week tey di leen wax ne nekkul ne da ngeen bon mbala dara la but mistake la at times and then Nikki come wax
good mistake, some are born with it.
Thank you. Yeneen du sa fault, you know. So di leen wax ne you guys are not isolated. Come ñu ngi seen ginnaaw whenever you need the support one time, man.
All right.
Yeah, mom.
Alhamdulillah, it was a good episode, I think. Kewa, thank you for coming up. I am just, here looking at you, imagining the Saati and all the things that you're exposed to. This is commendable. To me, these are the heroes of the country.
Yep.
In as much as they or people don't even know people like you exist. I'm just imagining when some people are sleeping in their beds, you're going looking after these people. It's commendable. And again, I keep on saying this, me personally, my tummy issues, I rather have HIV than, the tummy issues that I have. And if you're taking medications, one medication a day, it's better. HIV is not a death sentence. It's not promiscuity. You can have it through so many other ways. So again, it's free for treatment and care and all of these things. And I think, those days that I used to work at the AVSD, then you had malod and leg and all those sorts of things.
Don't stop now.
They can stop now, yeah. But that was just to encourage them. In terms of that. Again, like you said earlier, there was a dark days in the country where HIV AIDS was a problem, and that has stopped so many of the fundings. But again, seek help, get yourself tested regularly. And again, there are lots of things said, and then the mistakes, we always learn from it. Jamar of the week, I'll give it to you, Keba.
Yes, Keba.
I'll give it to you for looking
One
after the
Innovrec's
people.
newest team members.
Yeah.
Alhamdulillah.
Kon bebenen, salamu alaikum.
Wavy nurse. But what I'm going to end up Keba nagde.
Waaye bi dafa strand fu mu nekk nii kawar bi soo ko gisee kay
sponsor yi ñëwuñ pour wéef
yow nag
war a ñëw
salon si dañ la war a sponsor sax
boy
def la posted boy
fine boy no pimples
yow Musa
so mba falale coming kacha nyindiata kuma jamal fota bare mbe mol danila men na wolom kumol men fota jang ngata nga sobe yandi kato nga sasa lako kacha sasa me alon ko ka fa HIV jangar keso so HIV jangar keso nga dia mol kele nga kacha kele mol sa sotono mol ka sotono nyamen anim fanan amanke commune mol me alon ko ibe tulungol la futu o banta wala imam futu ibe tulungol la wal damale ka soto ngal ne sila jamal bi je mol ka sotono nyamen wala tin nka mol dani men la dinding keba muso kafuke nga katang kalita kalite ngam fangol test kato jil mu tesol di me alon ko ibuka hani fen joje free lom ni nata Innovarex ise testero ni soro noje e kaje fanan amanke dorong ni moye testin nyinke wala ye fanjibe pour ñun jankar keso abela dorong ila dunia dan tawolto mol nit ñi sasal balu tale fo isiol danta damen do li sanji jamal balu wa tara ñi sasa ñeng ame batandi sasa kote ndolle fa so anyanta kuma yala pour mol yalon ko ni ñin tesoke iko ko ñi HIV jankar ke sole bela ila dunia danta wolto wala abe fa la le tili dantang wala lokun dantang ñaato so wala na kuma ta bakele pour nga na jata kende nga muta kula me yalon ko me akuma ta bakele wato wati kalin tankam fantes anim fanan ni bitala ye mol mel long isamba nyola kato nyimu kulti me alonko sate dol beje be kolyar ne pour ye nyin testerol soto free la karola wala bu ko hani fenjo wala nyin jararo dol nga ma koy ro soto wala compagnie men boko Innovarex e kata kol ke foy nyin nati nyanen so ando ise service ol soto no wala coming mise cool soto no me alonko sina foy la suo kono na akacha dalom bang wala ka testi nyin kelom bang foy nyanta boro nyina tala ni ko mandiro ke keba e nombal dinu keba e segal hakilo bulani no nomba nyen nako tenkem 1 2 2 3 sa nyin ya 1 2 2 3 sa nyin nombal call no nakata nyin kar dal be bulu wala yaaje ko mi lafta testero nyin kela mol bi jele mel be nyin telephone ol koma wala mel be nyin mobile ol koma pour que la jabirol ila nyin karol jabi so al nga kata ba ken kalinanang itata loptano tay sey sotono je free loptan jamal bi je ka dile so mba falale bak ala baraka bak ale la moro menke nyin kumayata bak le katu ndolla siyo jang jama minti amanke pour kana ka si dor nan ka kacha ni kacha dor nan se dan no bungol kono nga kacha bari kacha nyin laftani na fala nat la wala ka mol hakil bulandi ka katanam pour nga na jata kende ajibe anin kal hakilo bulandi ko tenke kewol dimasi wo dimasi mbe Innovarex walem na clinic days pour kewol ala katale fintinan kewol ba katakande dol bina kanne mbamal na mbari musol ndi musol ala kata ale famal pus ye nana ye la jata kende ajibe muso nga mol jele musol jele me alon ko ka fo kele nana yela jata kende a jibe ke ala karola lombang la jata kende a balo mumelo meta kanyim fo janne ke o kuma ta ba ke suwo kono le so al nga katan kali nana na jambar of the week mbadi la anti binta manela mais alon ko abe fo jara soma l'hôpital tabe doku wala wala tele be doku wala HIV jankar keso la karola mol me alon ko kana ike because ike kala mutandi le janni be testero nyinkela ani fana ni test fo pareta aketa nyaawo nya fo ya soto le wala ma soto atele ke murum fana ni diamu mel fana ka borol ta fana atel ni ka kacha akela borol di la borol nafa anda ba kata kol beke kanne pour mol me nyi soto sako elarar ma fongola pour ye jata kende ya soto so andi binda mane mbafle ya baraka bake katu ngela effort sol jele ka kol men beke pour nyi mol ye la jata kende ya soto no so ndela jambar of the week mbadi la tella ala baraka bake
so jerejef just pour tëj episode bi rek bëggoon a wax ne lu gën a am solo mooy man I've always been passionate about human rights when it comes to wér-gu-yaram la rek man one thing lu ma fas yéene dëkk bi mooy nañ indiwaat mbiri HIV si just mbiri wàllum wér-gu-yaram because noonu la war a demee njëkka la doorin bi dañ ko jëloon def ko loo xam ne comme bokkutoon si mbiri wér-gu-yaram te ñii suñ ay mag leen ñii ay suñ raka leen ñii ay suñ nijaay leen once again ku nekk soo fogee ne amuloo si loxo wala amuloo waala pour jéem a xeex HIV da nga xamul nu mbir bi demee te lu ma bëggoon a wax tamit mooy ne sax da nga gis ne ñu gën a important su ñun suñ liggéey bi mooy law enforcement officers yi te man dama bëggoon leen a ñaan pour gars yi mun a xam ne gis nga nit ki lu tax mu jóg doomi aadama nekkul position am pour judge ko waxuma ne luwaa bi dafa bonde waaye dañ war a understand ne is infected or you're affected by it yow muy sonal nit yi sax ñoo xam ne ñu ngi si liggéey bi lañ nekka yaa ngi put sa bopp at risk from a public health perspective so one tamit di jaajëfal ñoo xam ne liggéey bi dañ si yaagaa taxaw balaa Innoverex Ministry of Health NACP Action AIDS xam nga so many associate National AIDS Secretariat ñu yaaga di liggéey si HIV dafa bari ba nga xam ne ñooñu dañ leen war a jaajëfal because ñu bari Keba am na ay partners ñoo xam ne ñu ngi liggéey ñoom Kumba ñoom Alaaji Dr. Ndaw there's so many Gambians ñoo xam ne liggéey bi ñu ko bëgguta laal ñoom ñoo ko laal te seen liggéey dafa rafet because man over the past 3 months dama gis liggéey bi naka la méttee ba tax mu gën a tax ma sawar pour bokk si as a company loolu bokk na sax lu tax Innoverex bëggoon na sponsor episode bi just pour joxe endorsement bi liggéey bi any healthcare professional si lañ war a bokk te ndawi dëkk bi Gambie bi fu mu nekk nii maa ngi gisoon statistics 77% of our population is under 35 dëkki ndaw la so ñun ñoo xam ne àgg nañ place boo xam ne ndaw yi doon nañ di ñu déglu we have a responsibility pour reprogram seen mind bi pour gars gis HIV as part of just healthcare so please go get tested but obviously Jambar of the week is everybody koo xam ne spend nga 1 hour di liggéeyal mbiri HIV from the general population from the MSM community to the female sex workers to the drug users to the prisoners all those people were born a human being first.
Exactly.
The approach boobu lañ war a jël in terms of healthcare because it's not our right to determine who deserves care. So we'll continue doing the work alongside people like CAREBA, the Ministry of Health, National AIDS Secretariat, Action Aid, just to make sure suñ mission bi pour nekk àndandoor si mbiri wérgu yaram Innoverex loolu moo tax ñu jóg dañ see boole waale ñëpp waaye di gërëm ñu dee seetaan yëpp so episode bi please share leen ko hopefully nit na ko mën a seetaan nga change sa xalaat xam ne jamono bi utee na waaye ñëpp lañ bugga ñu dugal si seen loxo ba pare di jaajëfal boo yoo xam ne tey ay jàmbaar leen Omar Dr. Pa Lil Chaser ak ñoo xam ne nañ ñibbi nañ jël testing yow loo def nii di nga jox beneen nit courage pour xam ne dara ayu si ba beneen yoon wasalaam